Dr. Nishita?
Yes, sir.
You are very audible and visible here. Dr. Nishita is actually today's official moderator. So I was talking behalf of her. So without wasting any time, I'll hand over the session to Dr. Nishita. Okay, doctor, thank you.
Yes, sir. Thank you so much. Sorry for the technical errors and I was delayed starting.
That we can understand. It's very often that is understandable. No, not at all. Go ahead.
So warm welcome to all of you for the second National Ayurveda Cardiology Symposium. Today we have all the presenters with us and also the esteemed chairpersons with us. And today one of the esteemed chairperson with us is Dr. Sudhir Bagga, who's an MD, ABIHM, MBA, and over 40 years of health industry experience in direct patient care and medical management, utilizing disciplined conceptual thinking and operational excellence, develop software and video programs for patients and health professionals, integrative medicine, a practical application, science of life, total health management, and yoga for virtual health. He is a fantastic academician and he is serving as a faculty in University of California, Los Angeles from June 2000 to June 2002. And he's very active in his administrative work. As an administrative, he's working as medical director, chief medical officer in Science of Life, Life Science Medical Center, Healthcare Information Technology, Redondo Beach, California from April 1997 to present. He has worked as a medical evaluation board physician in Department of Defense, Fort Campbell, Kentucky, and this was between July 2013 to 2015. And from February 2010 to present, he's been the physician reviewer at BMD Medical Consulting. Between February 2001 and November 2003, he's been healthcare manager, medical director, healthcare services, DOC, State of California, Lancaster, California. And between May 1996 and March 1997, he's been medical director, ambulatory care and chief, Department of Family Medicine, GCAHO accreditation, High Desert Hospital, Lancaster, California. Between October 1995 to May 1996, he's been a part of industrial medicine and family practice at Bayford Medical Group, Carson, California. And between April to October 1995, he's been a consultant at IPA Medical Director. Again, Universal Care Health Maintenance Organization, Signal Health, California. He's been medical director, geriatrics at Lancaster Healthcare Center, California, between July 1981 to March 1995. Between April 1994 to March 1995, he's been a physician advisor, Interdisciplinary Information Systems Group, Antelope Valley Healthcare System, Lancaster, California. Between July 1993, March 1995, he's been a member of Quality Council, Lancaster Community Hospital, California. And between July 1992 and March 1995, he's been member board of directors, chief quality management, Sage Family Healthcare Group in Lancaster, California, chairperson, utilization management at Lancaster Community Hospital. And between July 1979 to March 1995, he's been a member, family practice department, Antelope and Lancaster Community Hospital, California, and then he's been a part of many medical committees, and one of them is Antelope Valley Healthcare Systems and Lancaster Community Hospitals, California. Between January 1975 to present, he's also been a very good clinician, clinical practice with direct contact with his patients. And it is also gives me immense pleasure to say that he's done his pre-medical education from Karnataka, me being from there, from Mysore, that is the Kasturba Medical College, Mysore, and he has completed his MBBS from Maulana Azad Medical College, Delhi, and then he's registered with the Central Medical Council of England, UK. He's been part of American Assurance and Utilization Review, American Board of Medical Management, Masters in Business Administration, American Board of Family Practice, American Board of Geriatrics, American Board of Integrative and Holistic Medicine, Diplomatic Board of Integrative Medicine. So a man with huge qualifications and with lot of background in administrative as a physician and as an academician. It's a blessing and privilege to have you here with us, sir. A warm welcome to this second National Ayurveda Cardiology Symposium.
Thank you so much, Nishita. You were just explaining too much. I'm audible, obviously, right? You can hear me.
Yes, sir. You're
right. So I used to teach UCLA at integrative medicine, and my interest with Madhav Bagga and Dr. Rohit Sane was or is in how do we integrate all the best medical systems together. And I've created an integrative electronic health record system which combines the allopathic system, Chinese system, Ayurvedic system, Unani system together. I'll give you a glimpse of what I believe would be helpful for all us health practitioners to integrate in a scientific way methodology that we could utilize, which the rest of the scientific world accepts and understands. I believe that the major issue right now is the Indian system not being accepted as widely as the Chinese Oriental system. It is because we are trying to utilize the Ayurvedic system in the concept, our culture is concepts of religion, concepts of culture. हम बताते हैं, ब्रह्मा ने बताया, वहां से शुरू किया. It is probably appropriate to separate religion and faith away from science. If we can do that, we have extremely competent, good information which can be given. The second way I'll try to explain today in a very small time period, how we can use the terminology which most of the scientists around the world will understand, rather than using the terminology which we as the Ayurvedic practitioners will speak, rather than utilizing Vak with Kaf, which is a very strange language or understanding. If I start speaking German right now, you will not understand that. So I've tried to correlate these concepts of basic concepts of Ayurveda and explaining it to the world in a scientific manner as best as we can at this time. Let me explain it again. It is not exactly correlated directly to what I'm going to say, but there is a reasonable good correlation between our basic constitution, the phenotype, the dosha, and the physiology of what an allopathic physician could understand. So let me share my screen.
Surely, sir. Just before you begin your presentation, I just want to ask our presenters to prepare, and then I just want our presenter, the first presenter, Sudhir Bagga, to be prepared, and we have 20 minutes of time for you to be prepared. Okay, and meantime, sir, we have another chairperson here with us, and he's our esteemed and beloved Dr. Gurudatta Amin, sir. He's also the Chief Medical Officer of Madhav Bagga, and it's fantastic to have two CMOs here with us present today at two different streams. So he's the Director of Easy Ayurveda, Director of Medimi. He has completed his BAMS and MD in Samhita Siddhanta. He has a PGDAMS graduation, and he is Six Sigma BB certified, voted as India's top 10 Chief Medical Officer. He has 33 research papers published, and he's seen on most of the North Indian television channels, I must say, on ZTV, TV9, UCN, Sam TV, and HID in Gujarat channel as well. And leading team of 450 doctors, and in me being one among them. So we're all really proud of we being guided by him. And he is also a research and development and product development. He's involved in all of these activities at Madhav Bagga. He also involved in patient improvement. He's the expert behind that, making all these modifications, bringing in new technology, and bringing the Ayurvedic science in the modern way to help our patients recover and reverse their diseases. And he has trained all the doctors here in Madhav Bagga and more than 1,200 Panchakarma therapists and PCEs. So it is a honor to have you here as a chairperson with us, sir. So it's going to be a beautiful combination of the two CMOs here, and we are waiting to receive this wonderful piece of knowledge from both of you. And as today's presentation, Dr. Sudhir Bagga will be presenting about establishment of the Center of Excellence on Personalized, Preventive, Predictive, Participatory, Integrative Medicine. So with all of your permission, I hand over this mic and presentation to Dr. Sudhir Bagga, sir.
So I'll share my screen. Is it all visible, or should I do a slide screen? Maybe a slide would be better, right? So as we just talked about, how can we establish, Madhavbog happens to be one of them, a center of excellence, which is personalized, preventive, predictive, and participatory integrative medicine. Basically, it is a precision medicine. And to utilize these methodologies and explaining it in a scientific manner, it becomes extremely important that we understand how to explain that in the best scientific manner we can. The integrative medicine as defined, because we have a consortium actually in US, which combines all the best universities, UCLA, Stanford, Harvard, MIT. What is integrative medicine? I think if we understand this, it might help to explain that to the world, what integrative medicine really is. And it's very clear, you can all read that, the practice of medicine, that reaffirms the importance of relationship between a physician, a practitioner, and a patient, focuses on the whole person, and is informed by evidence. And that is the crux. The evidence which makes use of all appropriated therapeutic, diagnostic, and disciplines to achieve the optimum health and healing. This is an exact definition, and I think it's extremely important to understand what integrative medicine really is. And that is not the way the world is being presented today. So I wanted you to say what the consortium believes that to be. What the vision is. Obviously, the vision of Ayurveda is exactly this. And we have science of life, which basically is knowledge of life, which is Ayurveda. That's what I am, a chief medical officer and the founder of that. And these are the basic management principles, which you all understand very clearly, because that's what Ayurveda is all about. Preserve health, promote health, prevent and cure a person of the disease, and provide health and disease-based knowledge, and enabling evidence and outcome-based healthcare. That is the most important thing. Now, what is our mission? I'm trying to utilize methodology, which will then use what Ayurveda has been using in the past with the radial artery pulsation, Nadi pulse, using that methodology, clinically validating the medical system, utilizing like heart rate variability, pulse wave, using a smartphone or a health assessment band to facilitate quality and wealth and health disease management. To understand that, I think the most important thing is that we all understand the central clock. Now, this might be, some of you probably understand that this is the basic crux of Ayurveda methodology of treatment and diagnostics. Chronobiology. As you all know, there is a master clock which is sitting in the hypothalamus, which is the suprachiasmatic nucleus. I'm using a lot of medical terminologies because I want to get that message across. That central clock relates to the peripheral body clocks. And there is a bidirectional information going back and forth, which then changes the genetic expressions. And that is exactly what Ayurvedics pick it up from Nadi. That's how they pick it up. But that is the knowledge. So the master clock and relationship to the peripheral clocks. And I'm not going to read the whole thing. You can all read that. This explains it a little more in a pictorial form. the suprachiasmic nucleus, the master clock, that is influenced by our dincharya. By the time we eat, when we eat, what we eat, exposure to light, the sleep, our emotions, all that goes to the suprachiasmic circadian clock, the master clock. Then that information is sent to all the peripheral body organ clocks and even to the cells through a methodology, which is an autonomic nervous system and the hypothalamic pituitary adrenal axis. Some of those terms might be too strange for you or maybe not, but we can discuss it if you don't understand, which is the neurohumoral part. And those three things, the parasympathetic system, the sympathetic system, and the hypothalamic pituitary adrenal axis. This is how the suprachiasmic nucleus, the master clock, sends information to the peripheral body organ clocks. That information sending is what's picked up right here. To correlate the terminology, which you people are very familiar with, and I'm trying to say it in a very scientific, in a subtle way, and I'm not saying it is exactly the same, but it matches closely with what Ayurvedics understand as Vata, Pitta, Kapha. Vata is hypothalamic pituitary adrenal axis. Pitta is sympathetic nervous system. Kapha is parasympathetic nervous system. It is important to understand that we need to bridge the gap between the allopathic mindset with the mindset of all Ayurvedic physicians, Chinese physicians, Unani, Tibetan, what we call Vata, Pitta, Kapha, Chinese call it Kun Guan Chi. Tibetan call it Rilling Rapsha Bacon. We scientists are calling it in a parasympathetic, sympathetic, and HPA. I am trying to bridge a gap so that we all understand the same language, because I think that's what's lacking in true integrative systems of medicine. This is a little more complex, but the genetic expressions in the central clock, there are genes. There are period genes, cryptochrome genes, and PML and clock genes. They're negative and positive genes. And these are controlled by what we eat, how we sleep, all that. And that changes in 24 hours. That is the most beneficial aspects of understanding that. When I was in medical school, 70s, many years ago, we didn't know all that. We thought that if there is a predisposition to a disease, we would say that the person, you have a family history of diabetes, you're going to get diabetes, chances are so and so. But actually that clock, the ticking of the clock is in our control. And that is what genetic expression and epigenetics is. And that's what is important to understand. We can control that in this 24-hour clock time periods. They change the gene structures through the genetic expressions. It is all in our control. That is what the true Ayurveda is. And we'll go into the breathing part, and it's all part of that whole system. And I'm using the terminologies specifically so that as if there are other MBBS doctors or medical doctors who are non-Ayurvedic can very easily comprehend, who do not understand Vata, Pitta, Kapha, or have the ability or knowledge or interest to get to that level. This is another pictorial information, getting the message across more clearly. The negative limbs, the PER genes and cryptochrome genes, and the positive limbs, the BML and clock genes. That's what makes the changes. That's what gives, we do not change the genes, we are changing the genetic expression. We're changing the turning on and off the clock of that particular disease. That is where Ayurveda, and because we are all Indians, that is where astrology comes in also. There is a genetic predisposition, but it is in our control. This becomes even more complex, but this gets the real message across. What we eat, the food, what we eat, what we imbibe, plays a role exactly into this clock. That is gastric lumina, and it explains it more clearly, but I'm not going to go deeper into this because it's very complex to get, and we'll just spend the whole 24 hours explaining that, but the message is important. The food, pineal gland, which we call Tisri Aankh, spiritual third eye sort of thing, that correlates relationship with the supracosmic nucleus. And just to make the message across, this is the structure of the brain, and that is what could be what we consider is the third eye. This explains the parasympathetic and sympathetic activities and its relationship to different body organ clocks and different ganglion, which then correlates with the 7 chakras. And I'm not going to more deeper into chakras because it becomes more energetic medicine. I'm going to remain focused in science at this time. Exactly the relationship between the brain waves. The Vata, Pitta, Kapha, and the gun of Rajas, Sattvic, and Tamas are very closely related to the gamma waves, the beta, alpha, theta, and delta waves. So there is a very close relationship. We just need to understand it, and we need to get the world to understand it in the terminology I'm using, because this is the terminology the rest of the world science understand. So I'm using the terminology, but explaining it to you in your Ayurvedic mindset, that is what needs to be said so that we can integrate our best medical systems together. This exactly is the circadian body clock. This, I'll explain it more so in Vata, Pitta, Kapha methodology, but different time of the day, different organ functions become more active. The highest blood pressure usually is around 6 or 8 in the evening. The highest testosterone production is 9 in the morning. There is a direct relationship of hormones, direct relationship of eating, sleeping, and that's what the circadian clock is. This is just explaining it in the physiological way. This is another explanation of the hormones which are produced at different time of the 24-hour time period. And this is also controlled by this whole master clock and its relationship and interaction with the peripheral body organ clocks and the peripheral body cells. Using the terminology, I'm using what we call prana, nadi, and I'm explaining that in the terminologies, what Chinese call it meridians and channels, we call it nadi. I'm trying to correlate all the best medical system rather than saying Ayurveda is the best or the Chinese is the best or allopathy is better. They're not. The body is what it is. It is our knowledge. It is our understanding. It is our education which makes the difference. I, as a physician, understand from my knowledge base. You, as an Ayurvedic physician, you understand from your knowledge base. But the internal body organ function, physiology and pathology is not changing. It is our education and our interpretation needs to be brought together at the same level. And when I explain more so in the Nadi about the Sushman, Idda, and Pingla Nadi, that's where the breathing comes in. That's what pranayama is. That's what we can do therapeutic measurements or use that to treat a disease. It's very amazingly simple. It is only our understanding which needs to be expanded rather than putting the visors on, just expand it, open it up. And that's what, at least nothing else, if you get that message across from today, what I'm trying to do would be all what I've done would be great from my perspective. This explains about the Sushman, Idda, or Pingla Nadi, and I'm not going to go deeper into that because we only have 15 minutes. This is basically what chakras are. I tried to explain that. And Idda Nadi balances kapha, balances parasympathetic information. Pingla is sympathetic nervous system. And Sushman is hypothalamic pituitary adrenal axis and vata. Expand your horizons, you will be with me. And this is different chakras and different organs which get affected. And these are 7 chakras and different organs which are affected in that. This explains very interestingly, if I can stop that. This is basically explaining the nadi. There was a very good physician in Varanasi, Sarvdev Upadhyay. He has written a very good book on Nadi Vigyan that has influenced me a lot. He tried to correlate the Vat with Kapha with the physiology and the pulse waveform of different nadis. And that's what is one of the ones which I use in Science of Life. And this is what started my journey to correlate the best of all medical systems. This explains it in the same format, the waveforms. This explains it in the better format, which with our technology and having a 24-hour band will give us the 24-hour chrono information, which will tell us different organs which are going to be affected. This explains it exactly the way you people understand of the Vat Pitta Kapha. On the left-hand side is the 4-hour clock of Vat Pitta Kapha, and on the right-hand side is the Chinese meridians. Chinese are more anatomically based, and the Indians are most physiologically based mindset. This is the way we can explain it better, and using a scientific thought process, we can pick up the same information which the experienced Ayurvedic physicians were able to do it. Now we have the ability through technology to get that information. In 24 hours, we can pick it up and change that through breathing. It's very simple. Once the disease happens, then we use the programs like the scienceoflife.com, which integrates the constitution with the disease and different yoga asanas, different herbs, different medicines, whether it's Chinese or Ayurvedic utilization. You can pick up the same information through sound waves. It might be too complex, but I want the message across. That is the most important thing. They are using the same sound wave. There is a little in San Diego, they pick it up from the loved up sound waves. They pick up the same information, which we pick it up from the pulsations. Breathe to relax. I used to work for the Department of Defense. There's an open source, and that is nothing but changing it through Idda, Pingla, and Sushman, breathing, teaching breathing through the right diaphragmatic ways and using the right nostril to get the best for that particular dosh, for that particular constitution or phenotype, parasympathetic, sympathetic, and HPA. This is just one of the slides which when you go to the Science of Life, you do these calculations, it will give you what percentages you have, what disease you have. This person happens to be predominantly Pitta constitution, happens to have these diseases. It will go into the database and look at what particular medicine would be most helpful for a Pitta constitution who has bladder complaints or bed sores. So it matches the dosh with the disease rather than only disease-based. That is the major difference, I think. Being an Ayurveda, that's what we should practice rather than being influenced by the allopathic mindset of the world. Unluckily, all over the world, people are utilizing disease-based mindset. That's the problem which I think needs to be changed. Ayurveda are saying for diabetes use these Ayurvedic products because they have less side effects. I think that concept needs to be changed depending on your constitution, your 24-hour dincharya, what you eat. That first needs to be done. And then depending on what particular herb we need to use, which then also should not aggravate the basic dosha. I'll give you an example. Like in diabetes, the jamun seed is used for diabetes. But jamun seeds, if it's used, it increases vata. So a person who is vata predominant, even though jamun seed might help the diabetes, I would not give that because I will make the basic phenotype constitution of the person worse, even though I'm helping the disease. And that just is my thought. And I want to share that, explaining it a little mindset the way I explained to the UCLA students in the past. This is the same thing. The person has a kapha constitution and has a particular diseases, and then the physician or the health practitioner chooses which particular medicine to give so that it doesn't aggravate the person's basic constitution. This basically explains it a little more scientifically way, in statistical ways, Science of Life does. These then explains the different herbs and uske veere vipak gun ras vagara bhi batate hain, Chinese bhi batate hain. All the details or explanation of that particular herb is on there. These are yoga asanas, and these yoga asanas are also relationship to the dosh and the disease put together, rather than only disease based. The quality of life questionnaires, that's one step beyond what the world is going. Even though we are helping the disease, but is the person's quality of life improving? These are very standardized questions all around the world. RAND Corporation and the Interpol corporations in Europe, they do that. So we use that. Are we helping the patient's quality of life? Are we keeping the persons in the best optimum health? That was a nutshell, and I may have used most of my time and done it too fast, but I hope that the message has gotten across. And anybody has any questions, you can ask me now or whenever later on. You can take my information down and you can connect with me and connect with Dr. Sane and Mother Bob, either way, so that anybody who's interested in the mindset which I'm trying to get to the world, at least I think the best thing I can do as a academician, as a teacher of integrative medicine. Thank you.
Take you so much, sir. That was a beautiful insight on how Ayurvedic doctors should further on see the diseases. And definitely it's a take-home message for all of us here. So thank you. And I wish we had more time to give it to you so that you could explain it more elaborately with us. Thank you so much. So now, with the due permission of all of you, I request our second chairperson here, Dr. Gurudatta Amin sir, to speak a few words about core treatment philosophy of Madhava. If not him, who else can do this better? Sir, mic is all yours.
I guess I'm very well visible and audible, right? Okay, thank you very much. Sudhir Bagga sir has very well explained the importance of lifestyle, circadian rhythm, along with that understanding or trying to explore and accept the Ayurvedic philosophy of Sattva, Raja, Tama, Tridosha, Panchamahabhuta. And based on that, if we start treating patient, then things become very, very, very easy. And that's what the Madhobag or the in our Madhobag we are doing. So let's start exploring very basic concepts. So at present, the era is of overnutrition. So all of us are aware that Bruhaniya, that means Santarpanothya Vyadhis has gone increased very well. And therefore, we need to take care of the Langana Chikitsa. So basically, whenever you come across any patient, there are two things what you need to analyze. First thing, what is the status of his anabolism? What is the status of his catabolism? If anabolism is over dominant, then you need to take care, or you need to take care of that patient with the help of Langan Chikitsa. If catabolism is dominant, then you need to take care of that patient with the proper Santarpana or Bruhana Chikitsa. Now, this is a very core philosophy of Ayurveda, and hence Vagbadacharya, even Sushrutācharya, has explained all those concepts in great detail, but they have labeled the Adhyaya with a Langana Bruhaniya Adhyaya. So that carries a great importance. So whenever a patient comes to you, you need to think about it, whether this disease is Santarpanothya or Apatarpanothya, and in this patient, what I need to do, Santarpan or Apatarpan. Based on this, if you plan your treatment, then things become very, very, very easy. It's not like that. If the patient is suffering with the acidity, you need to neutralize the acid. It's not like that. Ayurveda says you need to analyze that patient in great detail. And if the patient is suffering with the acidity and the root cause is overnutrition, then you need to plan for Apatarpana Chikitsa, a simple moog diet. If patient exceeds the quantity of that moog, it also can cause Amla Pitta and can affect the patient in a negative way. So over there, you need to understand that what I am supposed to do, this call has to be taken based on the analysis, whether the patient is suffering with something which is due to overnutrition or something due to undernutrition. Now, about Langana Chikitsa is explained, Shodhanam Shamanam Cheti, Dvidha Tatrapi Langhanam. Now, about Shamana Chikitsa, he has fantastically explained Dipana Pachanak Shutrut Nigra Atapa Sevana Martu Sevana Ani Vayam. Now, generally, while going through these sutras, we didn't find the great importance of these sutras. A simple sutra of Vyayama can help a patient to improve his pelvic floor muscle function, his erectile dysfunction, his anorectal issues. Now, these are the issues. That means anorectal issues, female genitourinary tract issue, male genitourinary tract issue. These are issues which can be dealt very well with the help of a Vyayama. Or if you can correlate it with the Mula Bandha, which is well mentioned in the Ayurveda, then with the help of this Vyayama only, you can even reverse the patient. When it comes to Atapa Sevan or Marutha Sevan, all of us are aware the importance of vitamin D and importance of sunlight and role of sunlight in converting the cholesterol into vitamin D. This is how it is going to reduce down your blood cholesterol levels, as well as it is going to improve your vitamin D levels. About Kshutrut Nigra, a very simple concept which we generally follow, that if a patient is suffering with the huge pedal edema, patient is suffering with the rise in the end diastolic volume, in that case, we can conclude that the patient is suffering with the Jala Dhatu Dushti, and over there, the Chikitsa could be nil by mouth. If you keep your patient in nil by mouth condition for just 24 hours, you can see a significant improvement in his weight, significant improvement in his blood pressure, significant improvement in his episodes of angina. So these are the very simple techniques what we are executing in Madhavbag, and these are the core philosophies of Madhavbag, that we are using all these small treatments which are very much effective. Moving ahead, about Shodhana Chikitsa, yes, about Vamana, Virechana, Nasya, Raktamokshana, and Basti. Now, these are the treatments which should be done if you are planning to, detoxify the body. Just with the help of exercise, you can do it. Just with the help of diet modification, you can reverse a patient. But if you feel that there are certain conditions where the stromous material is being collected into the vascular compartment, if there are the blockages in the coronary artery or atheromatous plaque is deposited, or unwanted things are accumulated in the body, then our Acharyas have given a sutra that you need to follow the Snehana Karma, you need to take care of the Abhyantar Snehapan, followed by the Shodhan, and then Samsajan Karma. Now, if you analyze all this system, this is such a beautifully designed that initially you take care of the Strotasa with the help of Abhyantar Snehapan. You take care of your endothelial cells with the help of Abhyantar Snehapana. You try to improve the functionality of the endothelial cells so that whenever you're going to give him a purgation or the emesis, at that time, the doshas which will be, mobilized from the shakhas while coming to the koshta, they won't stick here and there. And then they can be easily eliminated from the koshtas. So what I'm trying to tell you that the sutras of Abhyantar Snehapan, actual Shodhan, followed by Samsajan Kram. When we talk about the Samsajan Kram, it is such a fantastically designed that in early phase, they are advising Peya, Vilepiya, Krutam, Krutam, Chayusham, Rasam, Tribhi, Rathaika, Shashya. So in initial stage, they are giving you simple carbohydrate so that the GI disturbance, what is being caused by the Virechan or the Vaman, where the upper part of your GI tract is acidic in nature above the duodenum, and below the duodenum it is basic in nature. When you give Vaman or Virechan, it affects the pH of your intestine or whole GI tract. Over there, you need to go slowly and try to build up your GI tract health properly. And for that reason, initially you go with the Peya, then Vilepi, then Kruta Yusha, where you're adding protein into it, then Masarasa. So just see to it how nicely they have designed the sutras, and over there they're taking care of detoxification of the body, so that without damaging your healthy body parts, the doshas can be eliminated from the body, and then a Prakrutagni can be established. So this is what the principle of Shodhana. Now over here, I can say that the key mediators are ANS and the vascular health. So as we say ANS, out of this, the sympathetic system defines the overall catabolism, and the parasympathetic system defines the overall anabolism. If the patient is in anabolic dominance, then you need to take care of it with the help of Langan Chikitsa. If patient is there in a catabolic dominance, then you need to take care of that patient with the help of Bruhana principles. Now, these are the core principles what Ayurveda has explained, because all of us are aware that whenever the sympathetic is activated, the adrenaline levels will be high, heart rate will be high, the hepatic glucose production will be high, the patient is going to lose the body weight because of the raised metabolic rate. When the parasympathetic is dominant, patient will be little bit lethargic, heart rate will be low, BP will be low, and over there, the process of digestion will be well modified. So your intestines will be working well. So I feel that the ANS is a key factor which needs a proper addressal. And if you do that, then things can be improved very well. And over here, Ayurveda has fantastically explained the principles, how to manage these two systems. So Koshta to Shakha Gati and Shakha to Koshta Gati. When the Charakacharya or our Granthas are saying about Koshta to Shakha Gati, this is something, a sympathetic system, which is mobilizing the blood from your trunk to your extremities. And when they are saying about the Shakha to Koshta Gati, they are talking about the parasympathetic nervous system, which is mobilizing the blood from the Shakha to the Koshta. Then vascular health. Now, why vascular health is important? Because vessels are affected by the blood, and blood is affected by your food, by your exercise, by your stress, and whether you follow circadian rhythm or not. So I believe that the vascular health and the ANS system, these are the two things which needs a proper correction. And if you take care of the food, exercise, stress, and circadian rhythm, then things are going to be very, very easy to manage. About food, the Granthakara has very well said, the Charakacharya said, Atha tu matra shiti adhyam vyakhyasama. This has clicked us very well. Whenever he's saying that the matra is very important, as I said earlier, that if someone is consuming the moog in a bigger quantity than his requirement, than his agni, then that moog is also going to cause ama vikruti, or that moog, which is said to be a pathya, can cause amla pitta. But if you control the quantity of the food, then things can be improved very well. So this is a core principle or core philosophy of Madhubag, that we try to control the matra of the annadravya so that the diseases can be reversed. So over here, we are using this reference as a as a treatment for the better treatment of the diabetic heart disease and all types of non-communicable diseases. Then comes the exercises. About exercises, all our acharyas, specifically Sushatacharya, has explained all these things in great detail. But if we take care of the cardio exercises, which will take care of the increase in the heart rate, blood pressure, then weight training exercises, which will take care of the muscle building, because your muscles can't be built just with the protein supplement. For that, you need internal stimulus, which can be given just by weight training exercises. Then comes the stretching, which will take care of your elasticity in your body. And whenever we're talking about the elasticity of body, it's not about only muscles, it is about your blood vessels. And that defines the overall functionality of your elastin membrane. Just remember one thing, if you don't have elasticity, that is the elastin protein in your arteries, then the elasticity will be badly compromised, and that can cause rupture of the arteries, which will lead to a MI. Then the balancing exercises for better neuromuscular coordinations, which includes all types of yogas, which are going to help the patient to improve his gait speed, his proprioception, everything. And the last one, but not the least, that is a respiratory. If you improve your respiratory function, if you focus on your respiration, a parasympathetic stimulation can take place, and that will control your sympathetic nervous system. When you inhale, the sympathetic system gets activated. When you exhale, the parasympathetic gets activated. When you do anulom vilom, you are trying to balance the ANS. Just remember one thing, it's not that the sympathetic good or parasympathetic is good. The good is a balance between these two systems, and how this system responds to you whenever you need it. So for that reason, these 5 different types of exercises are essential, and at Madhubag we follow all of them. Then comes theory of stress management. If you try to address the stressor or a cause for the stress, then things are out of your control. But if you try to improve the thinking process of that patient, then things can be very well governed. For that reason, we need a happy hormone theory, which includes dopamine, oxytocin, serotonin, and endorphins. For dopamine, what you need to plan, help your patient to plan his schedule so that he can come out of his problem very easily and he can get the reward in terms of a dopamine surge. If you ask your patient to be with the pets, with the plants, with the people, then the oxytocin levels can be raised up, and that helps them to get a good feel and to come out of the stressors. Donation, giving something to someone or helping some patient to come out of his illness, this thing is also going to help your patient with the secretion of the serotonin, which is something which is a happy hormone, which gives you internal satisfaction and a good sleep at night. Last is a endurance, that is endorphin. If you exercise daily, then endorphin will be secreted. Now, all these things we have incorporated in the treatment plans, whenever we are treating NCD patients, and that gives us a good results in terms of outcome. To improve the circadian rhythm, what we need is a schedule of exercise, schedule of food, schedule of sleep, and schedule of work. So for that, we need to take a dietary recall of the patient, exercise recall of the patient, and this is going to help him to improve his circadian rhythm. When we say circadian rhythm, patient is not able to understand anything out of it. But if we tell them that the possibility of heart attack is very high in the early morning, and for that reason, you should wake up early in the morning, and this statement is going to make him aware that if I wake up early, then I can stay away from the heart attack. The simple, communication tips which can improve them to stay away from the MI or health illnesses and to stay connected with the circadian cycle, which is the natural wave on which a person should float. So that is what we are doing over here in the Madhova. If all these things are happening, then definitely a complete disease reversal is possible in terms of GTT, MPI, ECO, CT angio, and ABPM. When it comes to Panchakarma therapy, we need to understand that the Sneha Kalpana or the oleation therapies are basically going to take care of the cell wall. And cell wall is the most important thing in our body, and which is made up of fat. So generally, we try to hate the fat, or the propaganda, the agenda is to say that the fat is bad, but we need to believe that every cell is made up of a fat. And if you take care of the fat in the right way, it might be through the Ventra Snehapana, it might be through the Anuvasana Basti, it might be through the Abhyanga Chikitsa, which are the Sneha Pravicharana, then you can improve these patients very well. Then comes thermal vasodilation, which is going to take care of the fluid, electrolyte, sebum, and the reduction in SVR. Then comes Vamana Chikitsa, which is going to take care of the mucociliary clearance. We need to believe that Vamana Chikitsa is going to help you to eliminate the Kapha dosha from the Urasthana. And if you try to correlate this with the mucociliary clearance, then you will realize the importance of Vamana Chikitsa. Because if you simply improve the speed of cilia which are attached to the pulmonary tract, then you will realize the important mechanism by which the lungs can be clarified and things can be improved very well. If we talk about medicated purgation, it is going to take care of intra-abdominal pressure, lipid metabolism, venous drainage of lower limb. It is going to take care of the reduction of the peripheral vascular resistance. And this is how the medicated purgation is going to give you results in all the diseases which are Virechana Argha. So this principle we need to keep in mind, and that's what at Madhobhag we are doing. About the per rectal drug administration, the Chikitsa Sutra, we need not to get into the details. So whether it is Yuktarata Basti, or it is a Matra Basti, or it is Anuvasan Basti, or it is a Niruha Basti. The sutra is very clear and straightforward. What is your strategy? Whether you want to nourish the tree or you want to cut down the tree. If you want to nourish the tree, then pour water to the roots and the tree will grow. If you want to cut down the tree, then you just simply cut down the roots and tree will fall. This is the basic sutra on which the Basti Sankalpana is evolved. And over the year in Madhobhag, we believe in it, and accordingly we have designed our Basti products. Now, the last point where I feel the Sushrutacharya has tried to, bring everything in a line which can be considered as a best yukti praman, adanastu abandhavova, padatrana atapatra virahito. So what does it mean? He's saying if someone is a beggar, someone is having no any relative with him, can that patient be cured from the diabetes? Then Sushrutacharya is saying, yes, he can be completely cured from the diabetes. So what to eat, he has explained. How that patient should live a life, that is explained. How much that patient should walk, that is very well explained. What should be the mentality of that person, that is very well explained. What type of exercises in terms of Khanetva, Kupam. So these are the things which has very well explained, and I believe that this is what Madhobhag is doing. We are trying to control the life of the patient so that his life can be transformed completely. So instead of just following any molecule, which is the theory of modern medicine. I'm not saying anything wrong about modern medicine. We believe that the modern medicine is also full of knowledge, but the current practices are just around the medicines and the molecules. But Ayurveda is not at all around the molecules. Around is Madhavbag is or Ayurveda is altogether a 360-degree care, which involves exercise, lifestyle modification, diet modification, appropriate panchakarma therapy, and the most important thing, motivation, giving hopes and continuously adding fun to the life of our patients. So based on this, we are treating our patients, and that's all from my side. Thanks a lot.
Thank you so much, Dr. Gurudatta Amin sir, for concising the entire Samhita for us and how to treat a patient. So that was a fantastic vision into looking at how to treat a patient. Thank you so much, sir. So without further delay, with all your due permission, I would like to start off with today's presentations with our presenters. They're all set and ready to treat us with their knowledge. So the chairpersons, I have shared the list of the members with you, and I request you to mark against their names and send it back to us. And accordingly, we will be selecting the winner among them. So today's first presenter, Dr. A.M. Siddiqui. Sir, the mic and the screen is all yours.
Hello, very warm good evening to everyone. Am I audible? Hello.
Yes, sir.
You're audible, sir. You can go ahead.
Dr. Amir, you are audible. Please speak.
Okay. Myself, Dr. A.M. Siddiqui, practicing in Madhavbag, Boisar, since 10 years. And my today's topic is, as we have seen, last two presenters, they were talking about very much the correlation between the modern medicines as well as the Ayurveda. And it was very fine to understand the correlation, and it was giving more confidence. Yes, we can have a logical practice, day-to-day practices, and we can save the people, or we can help the people by these logical thinking. So I'll just go ahead with that logical thinking. I have practiced in my clinical, which I have given in the food or ahar. The case, it was a case of chronic coronary artery disease. So the topic of my today's presentation is the role of high ORAC value, that is oxygen radical absorption capacity, on diet in case of CAD patient. The present study was designed to evaluate effect of high ORAC value diet and portion control in a single case study, which I have encountered here. So यहाँ पे मैं सिर्फ ये कहना चाह रहा हूँ, लॉजिक मेरा जो पॉइंट है ये कि अगर हम एक पोर्शन कंट्रोल और एक मात्रा और क्वालिटी, दैट इज हाई ओरैक वैल्यू और एंटीऑक्सीडेंट डाइट के बारे में बात करना चाह रहा हूँ बेसिकली, इन चीजों को यूज करके कैसे हम एक कोरोनरी आर्टरी डिजीज की पेशेंट की लाइफ में चेंज ला सकते हैं. सो हम लोग आगे इन चीजों को डिस्कशन में भी लेके जाएंगे और देखेंगे. सो इसमें पेशेंट after the enrollment, patient underwent actually angiography to measure his plaque volume of his major arteries, and thereafter the next 2 months the patient was advised a reverse diet kit, which is our diet module, which is a scientifically designed diet box contain 3 portion ready to cook food products that fulfill daily requirement of breakfast, lunch, dinner, soup and early morning diet. After the 2 months, like वो पेशेंट को पूरा 2 महीने तक इस तरह के डाइट दिए गए जिसमें हाई ओरैक वैल्यू और एंटीऑक्सीडेंट और पोर्शन कंट्रोल, एक मात्रा में फूड पार्टिकल्स उनको फूड दिए गए, और टू अंडरस्टैंड कि प्लाक वॉल्यूम में इसका क्या इफेक्ट होगा. So after 2 months, a patient again underwent an angiography, because earlier he has went on angiography. So I have again repeated the to understand the result, again, angiography was advised. So डिस्कशन में ये था कि अगर हम लोग लो कैलोरी डाइट और हाई एंटीऑक्सीडेंट डाइट अगर देते हैं किसी पेशेंट को, तो उनके शरीर पे उनका क्या परिणाम होता है और उनके बेसिकली वाइटल्स पे उनका क्या परिणाम होता है, और वाइटल्स जो पैरामीटर्स थे वो वेट, ब्लड प्रेशर, प्लेक फॉर्मेशन है, और उसका ल्यूमेन वॉल्यूम कितना रिड्यूस हुआ है अगर हम इस तरह के डाइट मॉडल को यूज करते हैं। सो अगर हमें ये समझना है कि अगर प्लाक में कैसे इसका रिडक्शन हुआ है, तो हमें छोटा सा एक पैथोफिजियोलॉजी समझने की जरूरत है कि अगर ये प्लाक फॉर्म कैसे होता है। तो प्लाक बेसिकली हम दो तीन चीजों को समझते हैं कि समथिंग कॉल्ड एज फ्री रेडिकल्स व्हिच गोज इनसाइड आवर बॉडी थ्रू वेरियस मीडियाज, स्पेशली इन द डाइट और दी हैबिट्स और लैक ऑफ एक्सरसाइजेस एंड ऑल। सो ये हमारे शरीर में जाके हमारे ब्लड वेसल्स के एंडोथेलियम और वेस्कुलर इंजरी करते हैं, जो फर्दर जाके हमारे बॉडी में एक कंडीशन डेवलप करते हैं जिसको कहते हैं हम लोग ऑक्सीडेटिव स्ट्रेस, which plays an important role for the progression of atherosclerosis. So ये बहुत इंपॉर्टेंट समझने की जरूरत है कि ये पूरा साइकिल कैसे जा है कि अगर हमारे शरीर में फ्री रेडिकल ज्यादा होगा और हमको हमारे ब्लड सेल्स की इंजरी करेगा, और ये ब्लड वेसल की इंजरी से एक एनवायरनमेंट डेवलप होगा जो कि ऑक्सीडेटिव स्ट्रेस है, और वो बहुत हेल्प करता है प्रोग्रेशन ऑफ प्लाक फॉर्मेशन के लिए। सो इस थियरी को हमें रिवर्स करना था। थॉट यही था कि हम कुछ ऐसी डाइट में मॉड्यूल यूज करें जिससे ये फॉर्मेशन जैसे हुआ है, ये प्लाक फॉर्मेशन, वो वैसे कैसे रिवर्स हो सकता है। तो जिससे रिवर्स ट्रांसपोर्ट कोलेस्ट्रॉल ट्रांसपोर्ट मैकेनिज्म है जिसका हम लोगों ने यूज किया, और मैंने देखा कि इस केस में देयर वाज अ सिग्निफिकेंट रिडक्शन इन weight, almost 10% of weight reduction have been seen. Along with that, there was nearly 50% reduction in total atheroma plaque volume, which was found in this present case study. So हमें ये समझना है कि अभी हमने पैथोफिजियोलॉजी समझ ली है कि अगर हम फ्री रेडिकल्स हमारे शरीर में इंजुरी करेगा, ऑक्सीडेटिव स्ट्रेस होगा और प्लाक फॉर्म होगा, तो उसे रिवर्स करने के लिए हमारे डाइटरी मॉड्यूल्स क्या होंगे, वो हमने लो कार्बोहाइड्रेट यूज करना है। तो अगर हमें अपने प्लाक को रिवर्स करना है तो हमें लो यानी लो कैलोरीज फूड यूज करने हैं, एंटी इंफ्लेमेटरी डाइट यूज करना, ओके, लो एंटी इंफ्लेमेटरी, लो कार्बोहाइड्रेट, एंटी इंफ्लेमेटरी और ओमेगा 3 फैटी एसिड्स, ये सारी चीजें हमारे
ये तो
फ्री रेडिकल्स को रिड्यूस करते हैं, इंजरीज को अवॉइड करते हैं और हील करने के लिए एंटीऑक्सीडेंट हेल्प करते हैं। तो इससे हम लोग अपने वेस्कुलर फंक्शन को भी बहुत अच्छा इंप्रूव कर सकते हैं। तो ये सारी चीजें हमारे डाइट बॉक्स में इंक्लूडेड है, और जिसका रिजल्ट हम लोगों ने इस केस में, ये केस स्टडी में देखा हुआ है। Here is the case study of the patient. So patient was age of 50-55 years old, and he has earlier 6 years age male patient, and he has symptoms of, next slide please.
Please come to conclusion.
Yeah, so he has symptoms: chest pain, giddiness, heaviness and chest, heaviness in chest and dyspnea. We'll go just to angiography reports where we can find out the actual conclusion. Here the weight reduction was there, which I have mentioned in my discussion. There was almost 10% weight reduction, so almost 5 to 6 kg weight reduction was there. All the allopathic, almost 80% allopathic medicine was stopped. Next.
Doctor, please conclude. Time is done.
Yeah, on the angiography, yes, the concluding and concluding on the angiography is there that there was a 50% plaque reduction on angiography by the help of. So my concluding point was, if we use high ORAT value and low carbohydrate diet food in our day-to-day lifestyle, we can reduce the plaque by in a significant way, which is there in both the angiography reports. So thank you.
Thank you, Doctor. The chairpersons have anything to say? Or do we proceed?
Sudhir sir, you want to say something?
I'm trying to understand because we don't have much time. Let's listen to it, and then I will put everything together. It will be easier rather than doing individually.
Thank you,
That's
sir.
fine. The point just I would like to make is that at present the word is behind putting the stents in the arteries, and that artery which is elastic, if we put a stent into it, then it will become something rigid. So ultimately we are affecting the basic principles of cardiac physiology, that is coronary flow reserve. That means whenever the demand increases, the blood supply should increase. But if that is not going to happen, then it will create a trouble. But with this, that means reverse diet kit or whatever interventions you have, Dr. Amit, if you can reverse the blockages, then it is something which is really great, and you should be very much aggressive in reversing the CAD. So best of luck.
Thank you, sir.
So going to our next presenter, it is Dr. Vaidehi. Dr. Vaidehi Revendrakar. Please go ahead, ma'am.
Am I audible?
Yes, ma'am, you are. You can go ahead.
Presentation. Good afternoon, everyone. Role of Anuvasan Basti with resistance training in non-obese type 2 diabetes is my topic of presentation for today. Myself, Dr. Vaidehi Revendrakar. I am clinic head for Borivali East, Madhobag. The reason I chose this topic is, though found in minority of group, there is a high risk of hypoglycemia and mortality in non-obese type 2 diabetes compared to obese. Also, reduced muscle mass is the reduced muscle mass is the prime biomarker for type 2 diabetes. Also, the risk factor in diabetes is that it reduces the function, it acts as a for functional disabilities and for mobility limitation. Several reports have shown that type 2 diabetes is also associated with sarcopenia and frailty. Thus, the aim of my study was to evaluate the effect of Anuvasan Basti with resistance training in non-obese type 2 diabetes, maintaining the muscle mass and improving the strength, thus reducing the process of sarcopenia and improving quality of life. So for this study, patient data of 12 patient data was collected and observed for 60 days at Borivali East Madhobag Center. The patient selected had a BMI less than 24 and age group within 45 to 75 of either sex were selected. Those were diagnosed with type 2 diabetes. This study group was now administered to a Panchasutri treatment, in which first was Panchakarma. In Panchakarma, Basti, Anuvasan Basti with Anuvasan Basti of 240 ml with Bruhan Aushadhi was given to patient. This Basti included Ashwagandha, Ela, Gokhru, Bala and Atibala. Ashwagandha, as we know of, is a muscle mass improver. Also, it strengthens the upper and the lower body and distributes the mass all over the body. Gokhru helps in reducing the endothelial dysfunction in blood vessels caused by diabetes, and Bala and Atibala acts as Poshan and Bruhan by itself. The diet was managed with a high protein, low carb and a moderate fat diet. Also, 30 ml Grutapan was advised to all these 12 patients in their daily diet. Different form of barley and various products of barley were also advised to the patients in their diet. Exercise was customized and mostly focused on resistance training and weight training for these patients. Scheduled videos and practical sessions for 40 minutes were taken at clinic thrice a week. Ayurvedic medicines were prescribed in medicinal doses to all these patients. In this, Gudmar, which helps to improve the insulin sensitivity of beta cells, along with Haridra and Amla, made a powerful combination which helped in Shodhan and also acted as a Rasayan. Kumari, which has been told by Ayurveda, is the medicine which can be given in all 20 types of prameha, helped me in Bruhan and Dharan of the body. Also, Guduchi, which was given, acted as the best potent rasayan in the non-obese type 2 diabetes patient. All these patients during the treatment were monitored with various parameters such as HbA1c, lean body mass, and hand grip strength.
Please sum
This
up, last 1 minute.
this Panchasutri treatment next. This Panchasutri treatment gave me some impressive results in the following parameters. Body mass was maintained between 23 and 22. Next, the hand grip strength was improved from 0.8 to 1 kg in both the hands. Next, the lean body mass was maintained at 45, and the next, the HbA1c was reduced from 0.8% in 60 days for these 12 patients. Thus, according to Ayurveda, has told that the diabetes treatment to a pramehi should be given according to its bala. In krusha and durbal patients, santarpan and sanshanman chikitsa should be given. Next, thus, the Anuvasan Basti, which acted as Bruhan, helped me to reduce the Vata dosha. Kledotpatti was reduced with a low carb diet. Dhatwagni Mandya or the Agni Mandya was improved with herbal Ayurvedic medicines, and Dhatu Shaitilya was improved with resistance training. Next, also exercise, as we know, stimulates muscle to activate GLUT4 transporters, which help to open the cell membrane walls, thus absorbing maximum sugar from the blood and reducing blood sugar. Hence, I conclude that Bruhan Chikitsa with resistance training helps to reduce sarcopenia, improving muscle mass, and thus improving metabolic profile in non-obese type 2 diabetic patient. Thank you.
Thank you, ma'am. Any of the chairpersons wish to talk?
I think she's presented it wonderfully. My just one comment to general thing is, because I want you to start utilizing not disease only, it is important to understand the person's basic constitution of dosha. I think we as general health practitioners are not paying too much importance to the constitution. We are paying a lot of importance to the disease. And because the world, unluckily, is a disease-based world. But I think the differentiate between Ayurveda and older systems of medicine and allopathic is the constitution. Whether the person was predominantly, the way you're describing, this person was predominantly not a kapha predominant person, even though you wrote 24, more than 24, it should have been less than 24, the BMI. But I understand that. And I think it's very important to understand what the constitution was. And through some different methodology, if we can find the constitution and the disease, it will be great. But your presentation was very concise and wonderful. Thank you.
Thank you, sir.
Vaibhavi, I can say that consistency is really appreciable. You're seriously working on the exercises, and definitely it can give you a great results. You just need to explore more of the scientific knowledge of exercise, so that you can set some target, you can select the patient wisely, so that you can get the desired results. In this case, the HbA1c control was not that much appreciable. You need to see to it that how you can engage the patients for longer duration and bring their HbA1c in a control just with the help of exercises. You're already using Anuvasan Basti, so with the help of exercises you can do it, but over there you need to take care of the compliances and see to it that the control can be achieved statistically, as well as I can say medically also significant. So that's what the next target for you. But consistency is really appreciable. Keep it up.
Thank you, sir.
Thank you so much to both our chairpersons for your valuable inputs into this presentation. A gentle reminder to both the chairpersons to please mark give them marks in the Excel sheet that has been sent across to both of you on your WhatsApp. So please send me back the same Excel sheet with the numbers you're going to give them, and each of you will be scoring them at 10. So you will be scoring, and it will be at a total of 20, for which they will be marked for. So now going to the next presenter, we have Dr. Pradnya Rao. Ma'am, the screen is all yours.
Hello, I'm audible.
Yes, ma'am.
Myself, Dr. Prajna Raut from Madhavbag Borivali Clinic. I'm working in Madhavbag since 11 years. My topic is role of Panchakarma treatment, that is heart failure reversal treatment, in improving and maintaining health-related quality of life in chronic heart failure patients. This is a single case study for 6 years followed. Background is, in chronic heart failure patients, 40% patients struggle to socialize in daily routine activities, and more than 60% patients are having difficulty with recreation like sports and hobbies. In chronic heart failure patients, the mortality rate is very high, that is almost more than 75% within 5 years.
Make sure your presentation is going right. Your slides are not in the right order.
Yes, yes. Chronic heart failure patient is very high, and it's more than 75% within 5 years from first hospitalization for heart failure. Hospitalization are very frequent, which increase financial burden on patients and their families, even in impacts emotional health of family.
Yes, now it's visible.
Aim and objective to evaluate the effect of Panchakarma, that is heart failure reversal treatment, and compliance with regular follow-up in chronic heart failure patients to improve health-related quality of life. Next slide, please. 67-year male patient made anterior wall MI in October 2016, done PTCA to LAD and LCX, ejection fraction was 45%. But immediately after 2 months, the patient again hospitalized for acute heart failure with ejection fraction 20%. Then 2017, patient came to Madhavbag Borivali West Clinic. Next slide. His present complaints was grade 3 dyspnea, severe indigestion, constipation, and neck stiffness. Along with all vitals taken, the 6 minutes walk test was done, and he walked only for 2 minutes. The VO2 max was 5.7 ml. Next, please. Next, please. The diagnosis was made chronic heart failure with low ejection fraction. The treatment started immediately with the Panchakarma, heart failure reversal treatment, some diet modifications, oral medicines. Panchakarma, Snehan and Svedan. Ideally, Snehan and Svedan are called Purvakarma for main procedure, but in heart failure reversal treatment, it has significance to reverse pathophysiology. With the help of Snehan Karma, reduces shear stress from blood vessel, thus improves elasticity of blood vessels, reduces elasticity of reduces peripheral resistance, reduces blood pressure, and reduces cardiac workload. Svedan, which induce sweating, excretes accumulated excess water and salt from body, reduces viscosity of blood. Both the procedures helps to reduce water retention from body. Next, please. Hruday Dhara. It helps to reduce intercostal muscle spasm, thus reduces breathlessness, which is a major symptom in heart failure. Intercostal muscles are helpful to inhalation and exhalation of exhalation. Thus, it helps to reduce breathlessness. Basti, which is the decoction of Arjuna, Punarnava, and Vacha. Next. Arjuna is cardiotonic and hydrolipidemic properties. In Ayurveda, Arjuna called as a Vrudya. That means Vrud Mansapeshi Balla. It is also antioxidant, hypotensive, anti-atherogenic, anti-inflammatory effect. Aqueous extract of Arjuna reports to have 23% calcium salt and 16% tannin. Calcium plays an important role in contraction and relaxation of cardiac muscles. Thus, Arjuna are known to improve force of contraction. Even tannin are known to enhance the synthesis of nitric oxide and relax vascular segments pre-contracted and norepinephrine. Punarnava is also a potent diuretic, excrete excess water from body, thus reduces fluid overload, which is a major cause of heart failure. Punarnava also, the word means recreates new life, which helps to regenerate new cells. wherein heart failure, cardiac muscle cells damage is always in progressive state. Third content is vacha. It removes excess kapha, thus reduces congestion from cardiorespiratory system. It also reduces heart rate and blood pressure. It is also known as a neuroprotective, reduces oxidative stress, anticonvulsant, antidepressants, antihypertensive, anti-inflammatory, and antioxidant. Next, please. Diet management. The patient came with the severe indigestion, constipation, thus the Agni Mandya was there. To reduce that Agni Mandya, patient was kept on semi-solid food, that is like a Peya Vilepi. But again, the patient was a low EF patient, so that's why the water intake was restricted for 1 liter per day with salt restriction. Even the dairy and bakery products was avoided. Only pomegranate and papaya fruit was given. Light exercises like in-house exercise was given. The oral medications, cat peak, Tamoin, ARG-Kada was given. Next, please. Follow-up was taken. The day one Panchakarma was started, and still the patient is continued with the Panchakarma regularly, once in a month follow-up sessions. Next, please. Day one, patient weight was 68.3 and the BMI was 21.56. The patient is still maintained with his BMI and his weight. Even the blood pressure, initially there were 11 medicines, allopathic medicines for antihypertensive and beta blockers. His blood pressure was on lower side, even the pulse was on lower side. But medicines was tapered down, and after 6 years also, his blood pressure and heart rate is stable. Next, please. Initially, patient was having grade 3 dyspnea, but now within 6 months, the patient complaints was reduced, and now he is not having any kind of a cardiac symptoms. Stress test was conducted on 6 months, and the last stress test was conducted on December 2022, and his VO2 max is stable, is 24, and his ejection fraction initially was 20%, which was increased by 35%, and it is still. Initially, there was pulmonary hypertension, but there is no pulmonary hypertension. Yes, hypokinesia is there. He was having 11 allopathic medicines like Lasix, Ecosprin, Clopidogrel, Atorvastatin, Nicardia, and along with all 11 medicines, but it was within 6 months. So patient is not having any kind of a medicine, allopathic medicines now. Next, please. First and December 2022. Reports. In first report, the ejection fraction was 20%, and now it is 35 to 40%. Next.
Ma'am, please conclude. Actually, we have no time left.
Discussion. Due to myocardial infarction, heart muscles got weakened and patient landed into heart failure. But with the help of heart treatment, not only ejection fraction improved, but with regular follow-up, there is no cardiac symptoms, no complications, no rehospitalization. Related quality of life. Conclusion. Next. Patient has maintained his health in last 6 years. He is attending social gatherings, going for vacations. His routine life is absolutely normal. That means heart failure reversal treatment and its continuous regular follow-ups are effective to improve health-related quality of life in chronic heart failure patients. Thank you.
Thank you, doctor. Any inputs from our chairpersons?
Nowadays, it's very important to differentiate between diastolic and systolic heart failure rather than using just the heart failure. And that will help because diastolic heart failures are far more dangerous, especially because if people are doing cardiology related thing. So it's important. That's just a little comment, because if we're presenting it to the rest of the medical world, that will be some of the questions that can be raised. But you did a wonderful job. Good luck.
Thank you.
So, Pratna ma'am, a simple question. In last since 2017, you said, and the good thing was he was on somewhere 13 medicines, allopathic medicines, and you have tapered down all the medicines. Right now, he is not on any allopathic medication. This is something very huge achievement, I can say. Just I have a very simple question. How much money he has paid you in last few years? So that means since the day one, how much money he has paid you?
Since day one, I guess not more than 1.5
More than?
Not more than 1.5 lakhs.
Okay, so at the cost of 1.5 lakh, if we can maintain the health of a person who is having ejection fraction 20%, and if we can taper down all the 12 or 13 medication, then this 1.5 lakh is really, really very cheap. So best of luck, keep it up.
Thank you, sir.
Thank you so much, sirs, for your input. And I request our chairpersons to give marks to the presenter. And a kind request to all the presenters to maintain the time allotted, because we are running short of time and we want to respect the time. Thank you so much. So the next presenter now is Dr. Shri Krishna Kumar Yadav.
नहीं बराबर है, क्यों कर रहे हैं सब ऐसा? आएगा तू इधर ही रुक, तेरा आएगा, रुक अभी.
You're audible, sir.
Can anyone share my screen? Share my presentation. Okay, it's visible now.
Yes, it is visible. Please proceed.
Okay, thank you. Myself, Dr. Sri Krishna Kumar Yadav from Madhubag Desai's Clinic. My topic is role of Panchkarma treatment in with pleural effusion. Next slide, please. Here we can see that why choosing this topic. 1.1 million people hospitalized due to heart failure, and around 11.2 billion are expenditure in these cases. So we can reduce these expenses by doing our treatment. Next slide, please. Aim and objective: to evaluate the role of the Panchkarma treatment in a CHF with a pleural effusion, along with the improving quality of life in elder patient. Next slide, please. The case study, the case I chosen, a male patient with the age of 70 years, occupation is retired. The patient have history of CAD, went for PTCA, and after that he developed a CHF, and after that he developed a CKD. Due to this, he hospitalized 6 times in the last 3 months. So he came for us for treatment. Next slide, please. We went for treatment, Panchkarma, renal diet, and Ayurvedic herb. Next slide, please. The Panchkarma we use Snehan, Sweden, and Basti. The Panchkarma we can see the centripetal evolution, which improve the venous drainage, reduce peripheral resistance, reduce workload on heart. Sweden, we can see the Dashmul Kada remove the excess water and salt from the body, reduce viscosity of the blood. Next slide, please. Hridaya, it improve the local blood circulation of the chest muscle. Basti content Arjun Punarava Vacha, which reduce lipid level and it act as a cardiotonic. Next slide, please. Diet management: moderate protein, low carb, water restriction to 750 ml, no salt and sugar, moderate potassium. Medicine which used Arjun, Punarava, Vacha, Gokshur, Avla, and Pipli, Haridra, and Aranda. Next slide, please. Next slide, please. Result: we can see the pulse rate day 160, now 70, blood pressure 180, 130 by 80, now 170, weight 61 to 50, BMI 22 to 18, girth 90 to 86, VO2 max 12.38 to 15.8, creatine 2.7 to 0.7. Next, please. We can here say the changes in X-ray. The day 1, we can see the pleural effusion fluid is overloaded. Now in next and other 2, till date, there is no any pleural effusion. Next slide, please. The medicine day 1, he did the 7 medicines. Now he only on the Evabrate, Ecosprin, and Lasix. Next slide, please. The discussion, the how this condition develop: the cardiomyopathy, heart valve disease, diabetes, obesity, blood pressure, heart attack, and ischemic disease. These are lead to weak heart muscles, due to which the heart difficult to pump, less amount blood is pumped, and heart failure increases, due to which, next slide, please. Next slide. Due to which the other organ get failure. The Pipli here, we can see the Pipli is a Jwar, Agna, Vrishna, Snigdha, Ushna, Katu, Tikta, Deep, Maruta, and it help in the caste swasth, due to which the we can able to cure the pleural effusion. Next slide, please. Conclusion, the Panchkarma diet and Ayurvedic medicine, it's help in reduction, rehospitalization in CHF and increasing the, improving the quality of life. Next slide. Thank you.
Thank you so much, sir. May I now request our chairperson, Dr. Sudhir Bagga, sir, to say a few words.
Generally, I'm seeing this, being a geriatrician as well as family physician, our aim generally should be reduce medicines. And when I'm using the word medicine, I'm using it allopathic, Ayurvedic, all. And I've seen most of the people here are very happy that we're reducing allopathic medicine. It would be interesting to do some research because you gave like 6 or 7 Ayurvedic drugs, and I'm using the word drugs very loosely. Could that have been done by 4, 3, 2, or 1, or none, and just done the diet instead? It would be very interesting to do those studies because our aim should be getting rid of the patient's medicines. As a geriatrician, there are drug-drug interactions, there's a food-drug interaction, and in a scientific mindset, that plays an extremely important role. If you want to do a presentation and put it in Lancet or New England Journal of Medicine or JAMA, those things play a very important role. So it's important, and I see that this is very good that we reduced those, but it would be good to know, were we able to, or could we have done, instead of those 6 Ayurvedic medicine, could that same be achieved by 2 or 1 or none? I don't know. That's just a comment, but the concept is good, but unless we as physicians, as health practitioners go in that direction, then differentiation between the Ayurvedic mindset I'm talking about, and the allopathic mindset. Our mindset is, as a geriatrician, reduce medicines. Okay, whether it is allopathic or Ayurvedic or Chinese, doesn't matter. Reduce medicines. So that would be good to do. Very good presentation, but this is just a comment for general other researchers to go about, because that will help a lot.
Thank you.
Thank you.
Thank you so much for your review, sir. May I now request our chairperson, Dr. Gurudataman, sir, to put his.
Yes, I have a question, Dr. Krishna. So that patient has lost near about 7 to 8 kgs, right?
Yes, sir.
And his VO2 max is marginally improved. It is not significantly improved, right?
Yes, sir. At day 1, patient unable to walk at day 1.
Okay. Okay.
Well, I have to visit at home and have to start Pipli Rasad at home only.
Okay. So my question is, so Lasix 20, still you have continued it as it is, right?
It's an alternate day.
Okay. So you're trying to taper it down.
I am trying to taper it down.
Okay, but the improvement is there in terms of X-ray, but functional improvement is not significant. This is what I can see. You need to work on it more, because ultimately you need to push your patient just above 20. And what was the method of assessing VO2 max? It must be 6 minutes, right?
Yes, sir. Yes.
Okay. Any improvement or any change you have observed in its SpO2 levels before treatment and after treatment? Generally after exercise and before treatment and after exercise after treatment.
Before treatment, at rest only, SpO2 is around 90 to 93.
Okay.
Now after 6 minute walk test, his VO2 max is around 98, 99. It's normal now.
So this is important finding, very important finding. So it's indicating that the respiratory function is well improved, because when respiratory function gets deteriorated, then at that stage the SpO2 drops. But the cardiac function, when the cardiac function is affecting, it will affect the cardiac output. But in this case, I guess the cardiac instead of cardiac, the heart respiratory function is well improved compared to cardiac. You need to work on its cardiovascular more. But still, the presentation and the attempt is very good. Best of luck.
Thank you, sir.
Thank you so much, sir. Now the next presenter.
One suggestion to Dr. Krishna. So I'm taking if chairperson allow me. Basically, Dr. Krishna, can you take me to the slide where you have shown the changes in the X-rays?
I think a slide with Pallavi.
1 minute.
No, actually, the reason I have intervened, because the rest of presenters should understand because it was an excellent presentation, Dr. Krishna, and the way you have given the clinical result to the patient were mind-blowing. The where the can turn into the logic, or the logic can be perceived as a magic. Take me to that X-ray slide there directly. X-ray. Need down. Result one. Right. Yes. So Ayurveda is a pure logical science, and if we want to perceive, if we want to take this message to across the globe, with the simple thing that we should follow, when you are showing such results, always try to put the date when the X-ray was taken before, and what was the time after you taken the follow-up X-ray. So sometimes even by mere tappering, like, so even the tappering can give the such same type of results. But if you want to show the persistent result, then you should put it with a date and with time period, or the follow-up period, how much follow-up period took to get those results. So that is the only point I just want to highlight here, so all the young presenters who are here can understand and can rectify if they want to make such presentation in the future. That's it. Thanks a lot, Dr. Amin sir and Dr. Sudhir Bagga sir. Yes, Dr. Nishita ma'am, you can move to the next presenter.
Thank you so much, sir. Thanks for your valuable guidance through this presentation. So now going ahead with the next presenter, Dr. Anuja Dalvi.
Hello, good evening all. Am I audible?
Yes, ma'am, you're audible. Please proceed.
Please share my presentation, ma'am. Hi, good evening. Myself, Dr. Anuja Dalvi, Goregaon East Clinic Head. Today, my topic is role of diet modification and Panchakarma theory in the management of coronary artery disease. Next. Let's first see what is coronary artery disease. It's a narrowing or blockage of your coronary arteries, usually due to plaque buildup. Next, it's a life-threatening disease, right? So to lessen that risk, my objective is to evaluate the role of diet modification and Panchakarma therapy in the management of coronary artery disease in 90 days. Next. This is a patient medical history. Patient, age of 44 years, male patient, having history of hyperlipidemia and obesity since last 2 to 3 years. He was a symptomatic patient complaining of chest pain, came up with a report of stress test, which was positive for stress-induced ischemia with good effort tolerance capacity. Came up with report as coronary angiography report showing double vessel disease, and patient was advised for anticoagulation followed by revascularization, CABG. Next, patient didn't want to go for bypass, so he came to us with complaints of chest heaviness and chest pain on exertion. His day 1 parameters was as follows. Weight was 93.9, BMI was 32.11. As we all can see, his cholesterol values were raised. Total cholesterol was 230, triglyceride was 179, HDL 33, and LDL was 222. I personally advise him for the investigation as CT coronary angiography volumetric analysis to get an exact size of plaque volume in his coronary arteries. Next. Patient were on day 1, he was on these medicines, antiplatelet, statins, vasodilator, beta blocker, and some diuretics. Then we started his treatments. Next. So my diagnosis was in his case, coronary artery disease and hyperlipidemia. Next, my treatment consists of diet for 90 days. I advise him Panchakarma of 21 sittings, which includes Snehan, Svedan, and Basti. Some Ayurvedic medicines include Arjuna, Punarnava, Vacha, Dalchini, Patha, Vivita, Gokshur, Haridra, Amalki, Erand Triphala for Virachan. With this, some exercise program was also advise him for 45 minutes. My reverse diet kit principle was 1000 calorie diet, low cholesterol, moderate protein, high antioxidant capacity, of 65,000 ORAC value, richest source of vitamin C and vitamin E, low sodium, which help him to low down his lipid levels. Next, Panchakarma therapy includes Snehana. This involves the massage with til oil. Duration was for 30 minutes. Next. After that, Svedana was followed. This involves inducing sweating by immersing the body in medicated steam of Dashmul Kadha. Duration was 10 to 15 minutes. Next. After that, Basti was followed. Basti was given per rectal drug administration, medicated enema of aqueous extract of Gokshur, Haridra and Amalki administered per rectal route. Duration was 10 minutes. So the results was after 90 days, we get weight reduction from 93.9 to 85. BMI was reduced from 32 to 29. VO2 max was raised from 26.9 to 36. Next. His lipids were also reduced. Total cholesterol was reduced from 230 to 108. Triglycerides from 179 to 80. LDL from 222 to 21. Next. Plaque volume pre and post. As per the CT coronary angiography, which was advised in volumetric analysis, as we all can see in all the three arteries, LAD, LCX and RCA, day 1 plaque volume has been reduced. Next. Almost day 1 plaque burden was, as we all can see in lower line, 527.3 millimeter cube was day 1 plaque burden. And after 90 days, it was reduced to 339 millimeter cube. Almost 188 millimeter cube volume was regressed.
Last 1 minute.
So the discussion was the main components of CAT are atherosclerosis and impaired endothelial function. To decrease the atherosclerotic condition, low calorie diet was advised him with high ORAC value, which helped us to lower down his lipid levels. Also, dietary modification help us to improve reverse cholesterol transport mechanism, through which excess cholesterol from peripheral cells tissues from plaque return to the liver for excretion and plays an important role in reducing atherosclerosis. While the Panchakarma therapy helps us in improving endothelial dysfunction, Snehan helps for improving volume, blood returning to the heart. Svedan helps to improve blood supply to the heart, decreases peripheral resistance of the heart, peripheral resistance of the blood vessels. Basti, that GHA Kada helps us to improve release of nitric oxide from the coronary blood vessels, thus improving the endothelium and the health of blood vessels. This helps us in improving the dilatation of blood vessels. Next. So the conclusion is dietary modification help us in reducing lipid levels as well as improving reverse cholesterol transport mechanism. And Panchakarma helps us to improving impaired endothelial function. So we can definitely conclude that Ayurveda-based Panchakarma therapy and diet modification helps us to reduce plaque volume in 90 days. If same lifestyle modification is continued for next period, then we can definitely control the coronary artery disease. Thank you so much.
Thank you, ma'am. May I now request our chairperson, Dr. Sudhir Bagga, sir, to give your views about this presentation.
Your presentation was really good, but I think we need to look at the reality of coronary artery disease, what the world thinks for today. Many years ago, it was the blockage inside the blood vessel, and then doing PTCA, we would open the blood vessel and dilate it, we would do improvements. But the reality of that is more and more we are talking about is endothelial inflammation. It is the endothelium which is constricting the blood vessel rather than the plaque, rather than the cholesterol deposit. Cholesterol deposit does play a role, but lots and lots of studies are confirming again and again, it is the constriction rather than the actual plaque in there. So it's important to say that in the presentation nowadays, because that's what the world is, rather than the plaque or the cholesterol deposits. We were there a few years ago, but the presentation was very good. And I just saw one of the slides of yours in which you had deposited plaque as an important thing. And I wanted to share, and I put it in the chat section to explain that problem, and you've done a wonderful job. Keep up the good work.
Yes, sir. As
All
you
the
said,
best.
yes, sir. As you said, endothelial dysfunction is also a coronary artery disease, which shows the narrowing of the blood vessel without the presence of plaque. So, in this case, we have worked in both the case as plaque regression. That means lowering down lipid levels also, and to dilate the blood vessels. To dilate the narrowing of the blood vessels by with the help of Ayurvedic medicines and Panchakarma. Thank you, sir.
Thank you so much for your input, sir. May I now request our chairperson, Dr. Gurudatta Amin, sir, to give his views.
Very, very well aligned and very well presented. So
Thank
good
you,
job,
sir.
Dr. Anuja ma'am. Keep it up.
Thank you, sir. Thank you so much.
May I now request our next presenter, Dr. Meenal Naik, to take over the screen.
Good evening, all. Myself, Dr. Meenal Naik. My screen is visible?
Yes, ma'am, you can go ahead.
Yeah. So the topic of my presentation is role of Panchakarma and lifestyle modification in management of coronary artery disease in post-MI patient, a case study. A 45-year-old male worker by occupation approached with us exactly before 2 years, that is in May 2021. The patient has suffered through non-STEMI, and just a week back, he was thrombolized for that with LMWH and was advised for and had undergone angiography and detected with TVD, triple vessel disease, and advised for CABG. Patient was not willing to do so, hence approached with us for the non-invasive treatment. The patient has already undergone angioplasty, that is PTCA to LAD in 2014. He was a known case of diabetes and HTN since 2012. He was having complaints of chest discomfort and dyspnea on exertion grade 2. After examination, I have advised him to undergo CT coronary angiography with plaque volumetric analysis. His coronary angiography reveals 90% stenosis in the existing stent and 70% stenosis in left circumflex artery, 80% stenosis in right coronary artery. After proper examination, the patient is advised with diet, exercise as per effort tolerance, Panchakarma treatment, and oral medication. Diet with 1000 calorie diet high in ORAC value was advised for 2 months, along with move diet on weekly basis. In Panchakarma treatment, 5 sessions, as the patient has recently suffered through MI, the patient was advised for 5 sessions of Shirodhara, Jatamausi Shirodhara, and Tiltail Matra Basti, 5 sessions. And after completion of 4 weeks, the patient is advised for Snehan Svedan and Basti of Gokshur Haridra and Amalaki extract. Total 21 treatments were administered along with Sasneha Virechan. Here, Shirodhara plays major role in relieving sympathetic response, hence relieving anxiety of the patient. Basti has helped to reduce Vata dosh and helps in bowel regulation. Snehan is helpful to reduce peripheral vascular resistance. Svedan with Dashmul Kwat has helped to induce vasodilatation. Basti, which consists of Gokshur, Amalaki, and Haridra, Gokshur being a potent nitric oxide provider, has helped in vasodilatation, hence reducing endothelial dysfunction. Sasneha Virechan, the Snehapan, which is used in this particular case, is Panchatikta Ghrita, has helped in improving endothelial dysfunction. Oral medication, that is combination of Gokshur, Amalaki, and Haridra, is used along with Pippaladi Churna, Kumari Asav, and Patola Katu Rohinyadi Kadha. Certain exercises were advised with the help of spirometer, balloon, and smiley ball TheraBand. These are helpful to improve vital capacity of the lung as well. And the monitoring of patient is done with the help of MIB Pulse app. The patient is advised to share his diet plate photos, and his vitals were monitored with the help of the application. And the results which I got, I have mentioned here the results as per the timeline till the end of 1 year, but till date the patient is maintaining very well. His heart rate is improved from 84 to 68, BP from 140 by 100 to 120 by 80. Weight was, he has a significant weight reduction, that is almost 22 kgs from 102.8 to 78.9. His abdominal girth was reduced from 116 to 92 centimeter, which is indicative of great extent of visceral fat reduction. VO2 max, that is the independent predictor of cardiac mortality, is improved from 19.6 to 36.05. Duke treadmill score was improved from 1 to 15. 2D echo, initially the patient's ejection fraction was 50%. It is maintained till date. There was apical and basal inferior segment hypokinesia. So the apical hypokinesia has been stabilized, and right now the presentation is on the basal segment inferior hypokinesia. CT angiography with plaque volumetric analysis is done initially, which revealed 845.6 cubic mm plaque, which has reduced to 748.7 cubic mm after the end of 3 months. Total cholesterol was reduced from 241 to 129. This is without statin. Initially, the patient was taking statin, but it was stopped after 1 month. Triglyceride is reduced from 170 to 95.2. LDL was reduced from 166 to 79.2. HbA1c is reduced from 10.3% to 5%. In between the treatment, the patient's bilirubin levels were altered. The patient was having indirect hyperbilirubinemia, which was aggravated at the end of 2 months. Hence, Sasneha Virachan was planned and a liver stimulant is given to the patient, and the total bilirubin levels were reduced, and till date the patient is maintaining this level. Allopathy medications are reduced substantially. Almost 75% medications are tapered down. The patient was taking 2 classes of oral hypoglycemic drugs. They were stopped at the end of first month itself. Statins are also stopped. The patient's antihypertensive is still continued. Nitrates are also stopped. Metaxil, that is beta blocker, is reduced to 50%. Clopilate is continued as the patient is already having stent. Ecosprin is stopped. Pathogenesis can be described. Kapha prakopak hetu 7, and the risk factors like diabetes and obesity has led to vascular inflammation, which has led to dhamani plaque deposition, which can be correlated with dhamani pratichay. Vulnerable plaque rupture leading to myocardial infarction. Here, with the help of dietary management, portion control diet, it has helped in reduction in visceral fat, and has also helped in excellent sugar control. Panchakarma has helped to reduce vascular inflammation and improving endothelial and reducing endothelial dysfunction. Plaque stabilization is also obtained, which has led to improved blood vessels compliance, hence improved effort tolerance capacity, which leads to reduction in mortality rate. So I can conclude that Ayurvedic Panchakarma therapy along with lifestyle modification can definitely be a better option for alternative to invasive treatments like PTCA and CABG. In fact, superior than them, as it improves cardiac effort tolerance capacity, thus reducing mortality rate and also reduces in allopathy drug dependency. Thank you.
Thank you, Doctor. May I now request our chairperson, Dr. Sudhir Bagga, sir, to share his views.
Extremely good presentation. My general comments to all the presenters would be, please do not use trade names when you're giving drugs. Use the generic names, because if you're presenting to the world, we all understand, I'm talking about the allopathic medicines and also Ayurvedic medicines. At least it's important to use generic rather than trade names, because it's very difficult to understand. And because I'm practicing now, I'm teaching and I'm helping patients, they come up and I have no understanding what they're doing. And you're used to all these, but this is a general comment to all of them for future, because that will improve your ability to present to the world. And these are very minor things, but they play very major, important role for people to understand what they are. But keep up the good work.
We'll take it.
Thank you.
Thank you, sir.
Thank you very much, sir. May I now request our chairperson, Dr. Gurudatta Amin, sir, to share his views.
Yes, sure. Dr. Minal, fantastic improvement and a good follow-up. Periodic investigations were also performed very well, and you have a very good, nicely maintained the data. That is very appreciable. Now, second question is, what was the lipid level before giving a Snehapan? That is the first question. And second question is, how much amount of Sneha you have induced in that patient during the Snehapana procedure?
So lipid levels were, I have mentioned, LDL value was slightly on the higher side, and after giving Snehan, after giving Virechin, LDL values have been reduced.
Because there is a
Total,
significant reduction in LDL values, right?
yes, yes.
So how you
And
achieve
that
that?
is without statins. Statins were stopped in first month itself, and I conducted Sasneha Virechin at the end of second month, starting of first month, third month.
And the values, whatever you have presented over here, is before Virechan, or can you tell us what exactly is it? Because LDL values were near about 200 and plus
Yes.
earlier, and later on it came down significantly.
Yes, yes, yes.
So what was the
So
time
after
duration between this?
conducting Virechan, there was significant reduction in LDL value, and that was without statins. Statins were tapered in first month only, and the Virechan is conducted in first week of third month.
Okay.
So the values are without statin and after conducting Sneha Virechan. Now here I have administered total till 7th day. I have administered Snehapan, Panchadikta Gruta. So patient has consumed almost 210 ml of Sneha on 7th day.
On 11th day, he has consumed 210 ml. That means with
7th day, sir.
Okay, so if you calculate, then it becomes near about 500 or more than that, right?
Yes, yes.
Okay, so in spite of taking 500 ml ghee or oil, still his LDL level came down from 200 to somewhere, I guess, below 100. The levels were below 100, right?
Yes, yes.
Okay, that is fantastic. Good job. Keep it up.
Thank you, sir.
Thank you so much, sir. May I now move to our next presentation by Dr. Prajakta.
Dr. Nishita, there are certain questions in chat box. If a presenter can answer it in a chat box itself, then it would be better. Or if you can address those questions, or you can attend those questions and ask directly to the presenters.
Surely, sir. This message to Minal Nayakji, I think you should reply personally to the person asking this question. Please go through the chat box. Yes, ma'am. The screen is all yours. You can go ahead with your presentation.
Am I audible?
Yes, ma'am.
And my screen? Can you see my screen?
Yes, ma'am.
Good evening, respected delegates and my dear friends. My name is Dr. Prajakta Asnodkar, and my topic for today's presentation is efficacy of Ayurvedic Sneha Basti in patients with diabetic nephropathy. Diabetic nephropathy is a common complication in type 1 and type 2 diabetic patients. Over the period of time, high blood sugar caused damage to the glomeruli in the kidney, leading to renal damage and hypertension. There are 5 stages of diabetic nephropathy, the 5th stage being end-stage renal disease. Until stage 2, the patient has absolutely no symptoms, but as he progresses towards stage 3, he develops symptoms like edema over the legs, nausea, loss of appetite, etc. As a consequence of few noticeable symptoms of CKD, 4 out of 5 patients affected with CKD are not even aware of their condition and progressively lose renal function over the course of time and land up into renal dialysis. With this background, I would like to present my case study of a 69-year-old male patient who came to my clinic with chief symptoms of pedal edema, generalized weakness, reduced appetite, and reduced urine output. He was a known case of diabetes since 17 years and was recently detected with HTN and CKD. His USG showed signs of grade 1 medical renal disease. His serum creatinine was 2.6 mg per dl, and his 24 hours urine protein excretion test was pretty high, 4142. I diagnosed him as diabetic nephropathy. The normal urine protein excretion in a 24 hours urine is approximately less than 150 mg. In order to reduce his proteinuria and further renal damage, I advised the patient 12 sessions of Sneha Basti weekly twice for 6 weeks, followed by weekly once for the next 3 months. Snehan with Neem Siddhatil oil helps in reducing the sympathetic overstimulation, improves the vascular tone. Swedan with Dashmul Kwat by inducing sweat, reduces the fluid accumulation, causes vasodilatation, and improves the elasticity of the blood vessels. Sneha Basti consisting of Ashwagandha, Ela, Gokshur, Bala, and Atibala reduces the vascular complications, reduces the inflammation, reduces the oxidative stress, and acts as nephroprotective. The oral medicines consisted of formulations of Ashwagandha, Erand, Punarnava, Gokshur, Varun, Guduchi, Amlaki, Dhamasa, and Jeera. Ashwagandha being adaptogenic reduces the fasting blood sugar. Erand increases the creatinine clearance. Punarnava relieves urinary retention. Gokshur acts as a vasodilatory. Varun is a diuretic. Guduchi acts as a rasayan. Amlaki is antidiabetic and reduces the oxidative stress. Dhamasa and Jeera further protect the kidney from damage. A renal diet was advised to the patient low in sodium, phosphorus, and carbohydrates. His fluid intake, salt intake, and protein intake was restricted. Milk, dairy products, non-veg food, and bakery products were completely stopped. The vegetables were asked to cook by soaking and leaching techniques. Madhav Shakti atta consisting of barley flour, wheat bran was advised to make rotis. Pramya tea consisting of moringa, cinnamon was advised to the patient. His dietary and exercise compliance were taken regularly. Also, his fluid intake and urine output along with his blood sugar monitoring was done regularly. And these were the results. The serum creatinine, which was 2.6 on day 1, reduced to 1.17 after 120 days. The urine protein in a routine examination, which was 3+, reduced to trace urine in the urine. The eGFR improved from 51 to 59. The 24 hours urine protein excretion reduced from 4142 on day 1 to 2473 after 30 days, 1678 after 60 days, 1109 after 90 days, and 780 after 120 days. There was significant reduction in the HbA1c 6.9 on day 1, reduced to 4.9. After stopping all his OHA, we attempted a glucose tolerance test of the patient, which came out to be impaired glucose tolerance. His weight reduced from 78.8 kg to 68 kg. Pidilidimab had almost gone, but most importantly, the quality of life of the patient had improved significantly after the treatment. And these are the laboratory reports of the 24 hours urine protein excretion. As we can see, it was 4142 on day 1, which has gone down to 780 after 120 days. The allopathic medicines were also tapered significantly. 50% of the medicines were completely stopped, including the OHA and the antihypertensive medicines. Coming to the pathophysiology, diabetic nephropathy is a glomerular sclerosis and fibrosis caused due to diabetes. Hyperglycemia causes glycosylation of the glomerular protein, which may be responsible for messenger cell proliferation, inflammation, increase in the oxidative stress, and vascular damage. Excess accumulation of the extracellular protein is believed to play a key role in development and progress of diabetic nephropathy. Hence, reduction in the sympathetic overactivity, reduction in the fluid overload, reduction in the oxidative stress, dilatation of the blood vessels, improving the vascular tone, good glycemic control, and reduction in the inflammation help me in improving this patient of diabetic nephropathy. Hence, I would like to conclude, proteinuria should be considered as a valuable surrogate endpoint in patients with chronic renal disease. Ayurvedic Sneha Basti therapy, along with lifestyle modifications, stress management, can definitely help in reducing the proteinuria and thereby reducing the progress of renal disease in patients of diabetic nephropathy. Thank you.
Thank you, Doctor. That was a wonderful presentation. May I now request our chairperson, Dr. Sudhir Bagga, sir, to give in his inputs.
He's done a wonderful job of doing the pathophysiology of diabetic nephropathy. It's very good. It explains and understands in a scientific methodology, and the methodology you use is great, and wish you all the best. Keep up the good work.
Thank you, sir.
Thank you.
Yes, really, Prajakta madam, it is really very good, and the way you have presented, and second thing, the results what you have achieved is really fantastic. Keep it up.
Thank you, sir.
Thank you so much, sir. Now moving on to our next presentation. It's by Dr. Anuja C. Ma'am, the screen is all yours. Please go ahead.
Hello.
You're audible, ma'am.
Am I audible?
Yes, ma'am.
Good afternoon, everyone. Can you just share the presentation? Hello, myself Dr. Anuja from Adabak Science Clinic. My today's topic is role of Sahachar Basti and Tiktashar Basti. Tiktashar Basti in known case of PCOD with low BMI. Next. I had a patient of 20 years old with complaints of anorexia, fatigue, nausea, weight loss, pain in lower abdomen, irregular menses with scanty blood flow. Her weight was 37.3, BMI was 17, AG was 63 centimeter, and we had underwent the investigation of USG. Diagnosis, polycystic ovarian disorder. Next. We underwent here the Panchasutra Ayurvedic treatment, along with iron and vitamin-rich food diet, body cleansing procedure of Panchakarma, continuous monitoring, oral medication, exercise and stress management. Oral medications were given Saptaparna, Kiratatikta, Patol, Shunti, Tulsi, Musta, Parijat powder in the form of Kadha, Shunti, Marich, Pipali, Amlaki, Haritaki, Bibitak, Musta, Sovarjal Lavan, Ela, Patra, Vidanga in the form of Churna, Amlaki, Guduchi, Jeshtamat, Vidari, Kanda, Jivanti, Ashwamedha in the form of Kada. Few other medicines were given. Along with that, emmer, wheat plus barley plus roasted chana dal plus ginger plus cardamom in the form of powder as dietary supplement was given to her. Panchakarma treatments were induced of Snehan, Svedan and Basti. Snehan, Svedan, Basti included Sahachar Basti and Tiktashir Basti. We have done here the assessment of weight. 33.3, it was first day 37.3, day 30 it was 37.7 after inducing the Basti, 37.4 after day 60. On 90th day it was 38.6 and after 120 day it was 39.5. Her abdominal girth was 63, it increased to 68. Her BMI was 17, which increased to 18. And her last LMP when she visited our clinic was it was 15/7/2022. After 6 months, she started her menstrual cycle. That was on 21st, 1st, 23rd, and it was regularized for every 30 days, for 20 to 30 days cycle. It was then on 18/2 on 2023, 17/3 on 2023, and 15/4 after 120 days. Next. Here, Tiktashir Basti, which includes Guduchi, Kantakari, Vasa, Nimba, and Patol, Kadha, plus Panchadikta Grita and Sahachar oil with iron vitamins rich diet. Mode of action here was Panchadikta Basti is Kapha Pitta Shamak, Am Pachak, Pitta Rakta Shamak, balances dryness and Vat aggravation due to Tikta Rasa and Sheet Virya. Sahachar oil Basti is Vat Shamak, Kapha Nashak, anti-inflammatory, analgesic, improves blood circulation, elimination of metabolic waste. These two bastis were induced, Tiktakshir Basti and Sahachar Basti, so as to improve the Agni Dipan, Rasa Dhatu portion, and to decrease the cyst from that ovaries. Panchakarma therapies with lavender abhyangar oil, repeated oleation was done. Dashmul Kat liquid extract for thermal vasodilation was used. Sahachar oil 60 ml per rectal drug administration was given for almost 8 to 9 sittings, and Tiktashir Basti 100 ml per rectal drug administration was given. These are the reports. Before treatments, we had seen the cyst in the ovary, and after treatments, there were no cysts over the period of time of 3 to 4 months. conclusion was Agni Deepan. We have given her medicines and Panchakarma treatment, which induce Agni Deepan and Ampajan, which improves the liver metabolism, Rasarakta Dhatu portion, improves the blood circulation, and Garbhasya and Bij Granthi portion, and which led to the onset of menses after the month of 6 months. Thank you.
Thank you so much for your wonderful presentation, ma'am. May I now request our chairperson, Dr. Sudhir Bagga, sir, to share his views.
You've done a wonderful job. Again and again, it comes to my mind is, if we were presenting, if a UCLA student was presenting to me, a medical physician, the difference I see is not the outcome, but how would we present it in a way it will work differently. So if I was presenting, I believe use food as a medicine separately. And I think that is the most important thing. If we can change all the dincharya with only food, the best. And also the medicines, because we use multiple medicines, it is difficult to achieve or find out which particular medicine was more effective if you're using 10 of them. Could 3 would have worked or not? Unless we do that, and I think the major difference in the mindset of an allopathic person and an Ayurvedic is we sort of believe one medicine. Whether that one medicine is food or it is different, but if you're combining 5 different medicines to find out which particular medicine works, and the general concept of Ayurveda is all of them work put together. It's correct. It's okay. But whether this 5 or this 6 or this 3 or which 3, which 2, that's where I think the difference could be between Madhavbhav and the rest of the world, is if you want to make it, because whatever you've used, is that standardized by all the Madhavbhav physicians all over the country? If that is the case, then it will be great to start reducing. Suppose you had used 10 of them and all of them is standardized and everybody is doing the same. Could we try 6, 3, 2, or 1? That's where we should go in clinically evidence-based mindset for the world to start accepting this as a true science and has a value. But its presentation is great. Keep up the good work.
Thank you.
Thank you so much, sir. May I now request our chairperson, Dr. Gurudatta Amin, sir, to share his views.
Dr. Anuja, any hormonal workup
Yes,
like LH FSH ratio?
No, sir. We didn't go for that. LHS, FSH.
Okay, fine. So in sport, if you come across any patient, then please try to do that, because that will give you a different understanding about the hormonal axis. Yes. Okay, but otherwise it is very good. You have selected a different topic, and the cases are increasing. The number is very high, and if you're doing it or giving a good results, then it is really appreciable. Best of luck.
Thank you.
Thank you so much for your input, sir. Now moving on to the next presentation. May I now request Dr. Neelam Mahadik to take over the screen.
Hello.
You're audible, ma'am.
Yeah. Thank you. I'm not able to share my PPT. Pallavi ma'am, please share my PPT. Good evening, sir. I'm Dr. Neelam Mahadik, Vasai West Clinic, Mumbai. I'm presenting today. The topic is effect of Anuvasan Basti and Snehapan on secondary amenorrhea. Next, the objective.
Secondary amenorrhea occurs when a patient who had passed menarche goes 6 months or longer without menses. One of research said that around 26.5% of women affects with secondary amenorrhea after tuberculosis. There are many reasons for secondary amenorrhea, like pregnancy is the first reason, but in my case, there is a tuberculosis, so I have mentioned only a tuberculosis percentage. And a secondary amenorrhea in an unmarried girl is a big issue for her parents for future life. So I selected this topic. The patient medical history. The patient is 22 years, female, unmarried. She had menarche at 2010, normal menarche. In May 2018, she has cessation of menstrual cycle and have severe constipation and weight loss. When she visited gynecologist, she go through all the investigations and find that there is no hormonal change, but there is an ascites and appendicitis. So she went for surgery, and after that, she has taken 9 months of AKT. When in 2019 also, she has no motion without medicine. Amenorrhea continue after use of hormonal pills also. Next. When she came to me, this is my case presentation. Her height was 171 and weight was 41.4 kg. So her BMI was only 14.4, Ati Krusha. BP was 80/60, and this is in May 2019. That time she has a complaints of severe constipation for 8 days, even not responding to any medicine, not allopathy or not Ayurvedic. No menses in 1 year in spite of having hormonal therapy for 3 months. So as her hormonal levels were already investigated, I only investigated that time for HB 12.7, which was normal. So rule out the anemia, and USG pelvis was done. That time it was normal. Next. So according to me, the diagnosis was secondary amenorrhea with severe constipation. Next. So treatment, I advise her, I first go through her lifestyle, and I found that the treatment which was suitable for her is oral medication, which was Snehapana with simple Gurutta, which we have at home, purgation with the Panchasakar Churna, simple one, and Pachan with the Rasapachan. The Panchakarma therapy, which I had decided to go for, starting with Yog Basti Krama, that is 5 Matra Basti, that is oil Basti of 60 ml, plus 3 Niruha Basti, that is decoction of the Dashmula quart. Then orally means diet, Nidan Parivarjan, that is stoppage of junk food, only homemade fresh food, and the excess use of Gurutta. Next, the treatment with the timeline, which I have planned. In the first week, I only gave her a medication. Then from second week, daily Basti as per the Yog Basti Kram, that means 8 Basti. After giving 5 Basti, she passed first time motion. Then duration slowly comes to alternate day after 15 days. After 10 days, alternate Basti at home, because as the patient was not affording, I am not able to call her for every time in the clinic for the Basti. So I advise her to take Basti at home only, that is after 15 days for next 4 months. After next 4 months, there is a regulation of motion without medicine and the Basti. Next. After regulation of menses, without any hormonal medication and medication, menstrual cycle starts after 3 years of amenorrhea, that is in February 2020. She visited my clinic in May 2019. After say 9 months, it is February 2020, she got first menstrual cycle after 3 years. Patient had regular menstrual cycle till now, that is in May 2023. In May 2023, her weight is 56, so BMI came to 19.15. Her BP is 110/70 mm of HA. Next. So my result from this study is Snehapana and Basti help to regulating menstrual cycle in secondary amenorrhea after TB medicine and normalize the motion. Next. So in discussion part, I have mentioned only the sutra of the Vata dosha. So Vata guna is Tatra Ruksha Lagu Shita Khara Sukshma Shalo Anila. Here, according to me, the Ruksha guna was too much increased. So I have advised her Snehapana. The normal sides of the Vata dosha, we know that the Pakvasya Katistakti Shrotrasti Sparshanendriyam Tanam Vatasya Tatrapi Pakvadanam Visheshata. So the site of the Vat is hampered. So in specifically, we know that the 5 types of Vata and specifically Apana Vayu, normal karma are Apano Panaga Shroni Basti Medra Rupocharaha, Shukrartava Shakruna Mutra, Garbha Nishkramana Kriya. In my case, there is typical cessation of the menses, that is Artava is hampered. Even this constipation was there. So Vata dosha prakopa lakshana Kashta Karshoshna Kamitva Kampana Shakrudgrahan. So typical, the patient was Vata Prakopa Dushti. So I advise her the only Snehapana and Basti treatment, but for the longer period. Next. So this is the Vata Dosha Prakopa Chikissa according to the Varpataha, the Vartasya Upakrama Sneha Sweda Samshodhanam Mrudu, which I followed in my patient and I got a good result. Next. Thank you. The conclusion was Anuvasan Basti and Snehapana is useful in treating secondary amenorrhea. However, more research is required. Thank you.
Thank you so much, Doctor. That was a wonderful presentation. May I now request our chairperson, Dr. Sudhir Bagga, sir, to share a few words regarding this presentation.
Able to unmute.
Continue.
This is very close to my heart because I believe that the constitutional management is where we are different than the rest of the world. So this person was totally Vata, and you helped utilizing all the best Vata medications, management, and you did a wonderful job. And that's where I think we need to work on constitutional management in addition to disease management. Because we are only talking about diseases because the world, unluckily, is disease-based. But your presentation touches my heart because it's very close to my heart.
Thank you, sir.
Keep up the good work.
Thank you, sir.
Thank you.
Thank you so much for those positive words, sir. May I now request our other chairperson, Dr. Gurudatta Aman, sir, to share his views.
So as Sudhir sir rightly identified and said that this is really a very good way, and the good thing what I can observe over here is a very strong belief and a trust in Ayurveda. If you have that, then you can get such a miraculous results. I can call it as a miraculous results because if someone is suffering with the such type of complaints, then outcomes are not so positive. But over there, you have helped that patient, and this is really very good. But again, I will ask you one same question that there is a very close relationship between the Snehapana and the hormonal correction. So have you tried to analyze, any hormonal variation after treatment? As you said, before treatment, it was already done. Then after treatment, have you tried to analyze any difference has happened or not?
Actually not, sir, because as the she got the message, she was happy, and her parents said, we don't want to go for any hormonal or any other test.
Okay, fine.
Actually, I advised her, but the parents denied.
Okay, but whatever you have done, best of luck. Keep it up.
Thank you, sir.
Thank you very much for your insight, sir. So patients' improvement is more important than any other numbers. I think that is what sometimes we have to end up facing at clinics. So thank you for that wonderful presentation, ma'am. So now with all your due permission, moving on to the next presentation by Dr. Bhakti Somaya.
Hello, good evening to all of you. Myself, Dr. Bhakti Somaya from Chandigarh Clinic. Please start my presentation. Yeah, so here my topic is comparative study between Vatabhakti and Snehabhakti in management of type 2 DM patients. Next. So introduction. The main reason of type 2 diabetes is insulin resistance, as we all know. which in turn is caused by adipose tissue. Basically, by reducing adipose tissue or fat, we can easily reverse type 2 diabetes, but which have been proved by many researchers. But the challenge was there to treating low BMI patient whose body fat is already very low. So reducing adipose tissue gives lots of challenges and raises other complications as well. And also there are many patients which are sarcopenic. So in Ayurveda also Sthul Pramehi and Krish Pramehi, Kapha and Vata dominant respectively are described. In Chikitsa of Kaphaj Pramehi and Vataj Pramehi are also described differently. Next. Objective. So my objective is comparative analysis on the effect of Vata or Niru Basti and Sneh or Anuvasan Basti in low BMI type 2 diabetic patients. Next. So in this study, we have chosen 8 patients divided into the 2 groups. So first group was 4 patients with BMI more than 23, and second group was 4 patients with less than 23 BMI, which were Vata dominant, and first group was Kapha dominant. So Kapha Pramehi and Vata Pramehi patients were analyzed. So the Kapha Pramehi were treated with the Vata Basti 100 ml extract of Gudimar, Daru Haridra, Yashti Madhu. And the second, Vataj Pramehi, were treated with the help of Sneh Basti, in which there were 240 ml oil, 100 ml oil consists of 25 gram Ashwagandha, 4 gram Ela, 4 gram Bala, and 4 grams of Ati Bala. So all Balya Dravyas were added, which are good for sarcopenic patients as well for the good muscle mass growth. About the exercise, we have advised more stretching exercise significantly to the second group with the Vataj Pramehi. But to the Kaphaj Pramehi, we have advised more aerobic exercise. Then respiratory and balancing exercise both were suggested, same to the both groups. So duration of study was November 2022 to April 2023. Inclusion criteria HbA1c more than 6.5, age groups 30 to 66 years, diet low carb, moderate to high protein, and low to moderate fat. Low fat to the high BMI patients, and moderate fat, especially grit, have been advised to the low BMI patients. Study site Madhova Clinic, Chankheda. Next. So in the group 1, the Kaphaj Pramehi, or we can say high BMI patients, we have treated with the Snehan followed by Svedana. Snehan with Nimtil, Svedan with Dashmul Kada, and Kvach Basti. You can see the result that from day 1 to day 90, the weight reduction was drastic, from 77.45 up to 67. So almost 9.73 average weight loss were there, and BMI reduction was 4.5. Abdominal girth, especially AG, was reduced up to 83. So differences were 19.5. A good HbA1c result, HbA1c reduction was also found, and medicine tapering, and you can see all this. Next. This is the group 2, in which we have given the Sneh Basti. For Snehan Svedan followed by Sneh Basti. So in that, from day 1 to day 90, you can clearly see that from 64 kg, 64.67 kgs, it have been reduced up to 62.55 kgs. So the difference is only 2.12 kgs, but good reduction in abdominal girth. You can see 89.5 average abdominal girth, which have been reduced up to 82. In that, abdominal girth was reduced drastically, and HbA1c came up to 6.3 after 90 days of treatment with only 2 kg weight loss. Next. So here are the results. You can see Kvach Basti patients are from 77, it have been reduced up to 67. But in Sneh Basti, you can clearly see that no significant weight loss, but good HbA1c HbA1c reduction. You can see that. Next. So discussion in the patient with the help of Sneh Basti in low BMI patients, we can see that there was significant improvement in HbA1c without significant weight loss, but moderate to high reduction in AG from day 1 to day 90. Next. Improvement parameters, HbA1c was normalized. Sarcopenia also have been treated and muscle mass buildup was found very good. Allopathic medicine tapering quite good, 100%. Abdominal girth reduced and weight loss average 2 to 2.1 kg weight loss from day 1 to day 90 in low BMI patient. Next. So here is the conclusion that from findings of our study, the low BMI patients whose adipose tissues were already very less and also suffering from sarcopenia as well were treated successfully. Here we observed that with the help of Swedan followed by Snehbasti, Tilate processed with Balya Dravya, Bala, Atibala, Ela, etc. We found very good results in reversal of diabetes without significant weight loss and other complications in low BMI type 2 diabetic. Because previously when we are treating them by the losing their weight, there are so many complications which arises. But here we have we didn't found any complications in those patients whom we have given the Snehbasti. We observed significant improvement in HbA1c, AG and medicine tapering. Hence, the bigger challenge was there to get reversal without significant weight loss have been accomplished with the help of this Snehbasti. In Ayurveda also, it have been described Vataj Prameh. Vataj Prameh is Kashta Sadhya, but Kafaj Prameh is Sukha Sadhya. So, the Kashta Sadhya Vyadhi, so Vataj Prameh can be treated with Sneha and Balya Dravyas in Charak Chikitsa Sthan Adhyay 6. So, with the help of we treated Krish Pramehi without any complications after the treatment. Next. So, these are the references. Next. Please finish it up now. Yeah, this is our team. Next. Yeah, thank you.
Thank you so much, Doctor. So may I now request our chairperson, Dr. Sudhir Bagga, sir, to share his views. Done, sir.
Thank you. This is wonderful to experience same disease with different constitution. That's what I think is the answer where we differentiate between the rest of the world, because this is what, when I did my presentation, if you had seen, this is what precision personalized medicine is all about. And that is where both were diabetics and both were able to be, you managed it constitutionally based. That's what the difference is. The added thing which could help a lot is even then we are doing the constitution to see that these particular medicines, if we are using medicines or Sneha, whatever we are using as a basti, which particular medicines would be effective and could less be more effective. Because when we were talking about earlier, do no harm is number one in all medicine management. The Ayurvedic community wants to say that we are doing no harm. And you know, as physicians, as health practitioners, that's not true. We all are doing harm. So let's do no harm, number one. And how could we do that? Reduce the number of medicines, improve the health, management, dincharya, do concentration on that. We can make a dramatic difference in the health of the world. That is where the concept is. And constitutional base, you did a wonderful job, but we need to be more specific for the world to start accepting it in a scientific way. Yes. I mean, Ayurvedic way, you've done a wonderful job. I mean, because I understand that, it's easy for me to understand. But I think if I go and explain that to the UCLA head of the departments, I think it'll be difficult till we become a little more precise in understanding. But I'm glad constitutional based. Keep up the good work. Thank you.
Thank you so much, sir. That was a very powerful message from you. Do no harm to anyone, be it in whatever stream of medicine it is. Thank you for that. Well, now moving on to our next chairperson, Dr. Gurudatta Amin sir. Please kindly share your views.
Yes, very nicely presented, Dr. Bhakti Somaiya. One question for you.
Yes.
You have kept these two groups on different exercises. Any special observation with that?
Yes, sir, because I want stretching exercise more in low BMI because their muscle mass buildup is already less. And adipose aerobic exercise, or you can say cardiac exercise, or that things loses more adipose tissues. And the low BMI patient have already less adipose tissues. So for that, I have suggested more stretching exercise for the muscle mass buildup. Because
Okay, so I'm trying to go into a little bit deep. So can you tell me what type of communication you had with your patient? So you do this. So how that process of explaining the exercises to patient has happened over there?
Yes, sir. Sir, I have asked my patient that in Hindi I can say to like
Yes,
कि
yes, please
आपको
proceed.
आपको चलना या दौड़ चलना वॉकिंग आपको इतना नहीं करना है, आप 4,000 स्टेप 4-5,000 चलोगे तो चलेगा, बट आपको जो एक्सरसाइज जो जैसे आपका मसल मास बिल्डअप आप हैंड्स से ऐसे मतलब उनको दिखाती भी हूँ मैं मेरे क्लिनिक में, तो आई कैन से दैट आपको स्ट्रेचिंग एक्सरसाइज ज्यादा करनी है, आपका मसल मास बिल्डअप ज्यादा हो, आपको नी जैसे फुट पंप एक्सरसाइज है, नी बेंडिंग एक्सरसाइज है, देन दैट काइंड ऑफ थिंग्स आई सजेस्ट देम मोर.
Okay, good. That is really appreciable. So, good job. Keep it up. If you give more weightage to such type of exercises, then along with the Panchakarma medicines, you can achieve a very good results. Just keep it up. Continue it. Best of luck.
Thank you, sir.
Thank you so much, sir. With all your due permission, moving on to the next presentation by Dr. Mitali Makwana. The screen is all yours, ma'am. You can go ahead.
Hello, good evening all. Myself, Dr. Mitali Makwana, and practicing in Gotri Madhobad Clinic. Please my presentations, Pallavi. So today's topic of presentation is efficacy of Asthapan Basti with Gokshur, Haridra and Amalki in Kafaj Hridroga with type 2 diabetes. Next slide. And my objective is a single case study of successfully treating a case of Kafaj Hridroga in diabetic patient with Panchakarma and Ayurvedic medicine. Next slide. So medical history is a female patient of 58 years old. Occupation wise, she is housewife, and she had episode of breathlessness in October 2022 and hospitalized for that reason. Before this episode, she never checked his health condition, and she never felt any symptoms regarding diabetes or heart disease. So case description, a patient came with the complaints of chest heaviness, dyspnea on exertion, lethargy, high sugar levels, and patient had done following investigations like HbA1c was 9.5, TSH levels was 10.9, and lipid profile, the cholesterol, total cholesterol was 169 mg per dl, triglycerides 73, LDL cholesterol was 116, and HDL cholesterol was 38, and the ratio was total cholesterol and HDL ratio was 4.45. And in 4D echo with GLS, there was a ejection fraction of 41%, GLS minus 8%, and diastolic volume was 169 ml, and systolic volume was 83 ml, stroke volume was 85 ml, and the impression was dilated cardiomyopathy with ischemic etiology. Next slide. So we have advised her to do anti-pro-BNP test, and this anti-pro-BNP levels was 610.2 pg per ml. These levels after 4 therapies of Panchakarma, and she was taking many kind of diuretic tablets in allopathic like Sismida, Lavoxine, Concor, Iptus, Ditor, and Ivabrad and Vercuo also. And she was prescribed oral hypoglycemic agents and Thyronome 25 mcg, but she had never taken this oral hypoglycemic agents. Next slide, please. So my diagnosis is Kafaj Hridroga with type 2 diabetes and hypothyroid. Why Kafaj Hridroga? So there is a Sushrut Uttar 43 chapter. Description was like this. Description is like this. Gauravam Kafa Sansravo Aruchi Stambho Agni Mardavam Madhuryam Apicha Asyasya Bala Savatate Radi. She was feeling same symptoms. Gauravam, heaviness in her chest and body, Aruchi, and also Mukh Madhurya also there. Next slide. So what kind of treatment we have given? Oral medications. I have given Kokshur, Punarnava, Haridra, Amalki, Mehshingi, and Daru Haridra. And 2 months diet, 800 kilocalorie per day, low carbohydrate, moderate protein, moderate fat, and high fiber. Next slide. And in Panchakarma, total 21 therapies given, Abhyang with Til Tel, Swedan with Dashmul Kadha, and Asthapan Basti with Gokshur, Haridra, and Amalki. So here are the results. We can see the improvement in LDL cholesterol. It was reduced 116 to 107. These all parameters are after 3 months of treatment. And HbA1c reduced 9.5 to 5.7. Thyroid levels, TSH level reduced 10.9 to 8. Weight reduction from 65.5 to 56.2 kg. Abdominal girth reduction 89 centimeter to 81 centimeter, and BMI 27 to 23. She was taking all that medicines. Now after 6 months, she is not any kind of allopathy medicines. And stress test on November, total exercise time was 11 minutes 30 seconds, and her VO2 max was 23.1 ml per kg per minute, and MAT value was 6.6. And after 3 months of treatment, total exercise time increases 13 minutes to 12 seconds, and VO2 max was 29.4 ml per kg per minute.
Ma'am, kindly come to conclusion.
Yeah, next slide, please. So in 4D echo, we can see the diastolic dysfunction. This is the before treatment report. Diastolic dysfunction was grade 2, EDV 169, ESV 83, and SV 85, and GLS was -8%. And next slide. This is the after 6 months report. Diastolic dysfunction grade 2 reduced, and EDV 144 ml, ESV 73 ml, and stroke volume was 72 ml, and GLS increased to -11%. And her all symptoms are reduced, like chest heaviness, DOE, lethargy, and she now feels energetic to do any kind of work. Next slide. So in discussion was in modern aspect, how we got this improvement. In this case, we had to reduce, first of all, our preload in heart, as EDV value and SV value were high, and diastolic dysfunction grade 3 presented, and ischemic heart disease should reduce lipid levels and improve vascular health. So
please kindly conclude.
So here Gokshur, Haridra, Amalki improves intrinsic and extrinsic nitric oxide secretion in coronary blood vessels. And next slide. And in Ayurvedic aspect, we give treatment for Samprapti Vigatan. So Samprapti is Dushaitva Rasam Dosha, Viguna Radayam Kata, Radi Badha Prakurvanti, Radrogam Prachakshate. So Gokshur, Amalki, and Haridra work in Hridroga by breaking its Samprapti. It pacifies the vitiated doshas by its 3 dosh Shamak, Vatanulomak, Srotas, Shodhan Gun, and nourishes the Rasadi Dhatu. It conditions Agni to make sure proper formation of Rasadi Dhatu. Amalki removes clay located in the basti, and Haridra clears the doshas in Med, Mounts, and other dhatu. Together, the rasayan properties nourishes all dhatu, ojas, lasika, and replenish the bala in the body. Next slide. So conclusion is that in both aspects, modern and Ayurveda, the Asthapan Basti of Gokshur, Haridra, Amalki is effective on Hridroga because of its diuretic and anti-inflammatory properties, and also effective in type 2 diabetes because of the Rasayana properties. Thank you so much.
Thank you so much, Doctor. Now, may I request our chairperson, Dr. Sudhir Bagga, sir, to share his views.
Please unmute.
You've done a wonderful job. 2 or 3 things again. Try to use generic drugs names rather than the trade names. One of the person earlier did that. I was quite pleased. The other thing is, it's very fascinating that you were able to get rid of the thyroid medicine on a patient. Which particular medicine had the thyroid ability to work on? Do you know which one could have done that? That you were able to get rid of the thyroid, the thyroxine? Which medicine could have done that out of the ones you used? I mean, you've used the most common one, the Gokshur, Haridra, and Amalki, which are very good. I mean,
yeah, sorry, sir, I missed the written. Kanchinar Gugulu also have given.
Oh, okay.
Oral medication.
Okay. The other comment I would want to have, maybe Dr. Amin, you could do the research. I have discussed this with lots of Ayurveds in the past. If we could, you know, when 100 years ago, when a doctor would go and do a home visit, they would have in a bag of particular medicines that would work on lots of patients' diseases, what the patient would have to give. So the doctor wouldn't have to carry the whole 10,000 medicines. So there was somebody saying that if you all do some sort of a research or do a competition, which all 6, 7, 5, 6 medicines, and I'm using the word medicines, Ayurvedic, which could work on most of the common ailments which are affecting the world today, and having a doctor's bag of the most common ones, and then work on that, because what that will do will help us to come up with only maybe less than 5 or 7, 6 or 10 medicines, which could do the maximum research and get to the world, because that will help. And one of the, a few of my older Ayurvedic physicians who have been practicing for many, many years, they used to carry 6 or 7 medicines whenever they would do home visits. That would be a very interesting concept, which I think maybe Dr. Amin can take over, and something that'll be great, because you've used most common drugs, but which ones have the most effect, which affects the most common lifestyle diseases at this time? I think that would be a good thing to work on.
Sure.
But
Definitely, sir. Definitely we'll do that.
But you've done a wonderful job. Keep up the good work. Thank you.
Yes, Dr. Mitali, really it is appreciable, and there is no question as such, but just continue it as it is, because you have monitored this patient very well and successfully reversed him. So keep it up. Best of luck.
Thank you very much, sir. Now moving on to the next presentation by Dr. Krupa.
Hello.
You're audible, ma'am.
Yes. Good evening, all of you. Myself, Dr. Krupa Chatrodia, Clinic Head, VIP Road Branch, Madhobag, Baroda, Gujarat. Today, I am going to present a retrospective cohort study on role of diet in dyslipidemia management in non-case of diabetes mellitus. I can't see my presentation. Yes. Next. So, as we regularly, while dealing with diabetes patients, we come across an associated concern of dyslipidemia, and it is generally established that include a sedentary lifestyle, with excessive dietary intake of calories, carbs, saturated fat, cholesterol, and trans fats are common causes of dyslipidemia apart from genetic abnormalities of lipid metabolism. And here we will evaluate the additional impact of low carb, low calories diet we prescribe for diabetes management or diabetic patients in further helping manage of dyslipidemia in these cases successfully. Next. My objective is to evaluate a response of low carb diet in dyslipidemia in known case of diabetes and to discuss the need to address dyslipidemia in diabetes patients. Next. As we know, we are prescribing Prameha diet box, 800 calories diet box in Madhobag. And concept of Madhobag Prameha diet kit is it contains vitamin C up to 500 grams per day, high antioxidant, and it is fortified with medicinal herbs like Haridra, Daru Haridra, Ashwagandha, etc. Low glycemic index, low carb, and high in protein and good quality fats it contains, and as I said, it 800 kilocalories value. Next. Material and methods I have used here. Total 18 number of patients I have taken for this retrospective cohort study. Duration was July 21 to February 23, and inclusion criteria is diabetic patients with dyslipidemia. Next. Treatment protocol I have used here, my mainly focused on diet, but as we are treating diabetic patients, oral medications as we are using in Madhobag, Glyinoma, Gudumara, Haridra, Daru Haridra, etc. Along with those medicines, I have prescribed Vimkol Churna, which contain Hingu, Kalonji, Jeerak, Pippali, Shunthi, Bilva, Chavya, Chitraka, and Lipox tablet, which contains Arjuna, Lasuna. All contains or all Aushadas are Ushna Gunatmaka and Deepaniya Pachaniya, because we are focusing on Medavaha Stroto Drusti here. And Panchkarma I have prescribed Abhyanga, Svedana, and Basti. Abhyanga with neem oil, Svedana with Dashmudakvatha, and Basti with Gudmara, Daru Haridra, and Yasti Madhupatha. Next. And so results are the use protocol in diet proved very effective in improving dyslipidemia while reducing dependency on statins, along with improving HbA1c, reducing the weight and overall morbidity to the patient. Day 1 and day 90 data, previous one. Average of weight 78.05 to 70, reduced by 7.46. BMI 29.9 to 27, 2.92, HbA1c 9.49 to 7.36, reduced by 2.30. Total cholesterol 206 to 184, reduced by 21.69. Triglycerides 269 to 171, 97.71. LDL 125.9 to 117.7, 8.23. Average HDL 44.95 to 45.16. Here we are maintaining HDL, a good cholesterol, so it is 0.20. And statins, not all patients are aware on statins, but still 0.33 to 0.09. So reduced by 0.24. Next, please. So my statistical data of weight loss, reducing in HbA1c and reduction in statins are like this. Next, please. Improvement in lipid levels graph of day 1 to day 90 is like this. Next, please. And so my discussion point is the present observational study analyzed the effect of low carb diet of 800 calorie in patients of known case of diabetes, found that there was significant improvement in dyslipidemia from day 1 to day 90. And secondary weight, BMI, abdominal girth, as well HbA1c, substantial improvement after dietary changes in diabetes patients. Next. And so I have concluded total 18 patients with dyslipidemia along with diabetes enrolled in this study for analysis. And from the findings of our study, low carb diet has been found to be very much effective for dyslipidemia patients along with diabetes. And apart from these, as Bagga sir and Amin sir has explained, Ek Aushadhi Prayoga or we can focus, we have to focus on Ahara Vyavastha of patient according to their Prakruti. Ahara, one of the Traustamba of Ayurveda. And if I can teach my patient how to eat, what to eat and when to eat, then I think I can make him free from all medicines and can help him to lead a healthy and quality life. Thank you.
Thank you so much, Dr. Krupa. That was a wonderful presentation. May I now request our chairperson, Dr. Sudhir Bagga, sir, to share his views.
I think I got my message across to some extent. It's very important to keep the food as medicine separately and the medicine separately. I think I don't have the list, but somebody is saying that in India, food, there are some which are considered food, not medicines. And there's a list which is only medicines. I'm talking about Ayurvedic, by the way. It would be interesting, and if Dr. Amin, you know, I'd like to see what medicines are part of that food in the Indian, which they consider food. There is some sort of a government list, because if we concentrate on that and see if we can make lifestyle changes, which everybody in India, government considers that as a food, because that will be easier to send it to the world. If I'm giving it to the physicians in integrative medicine in US, it will be very important to only use foods, and then it'll become easier to accept all over the world. So having that list somewhere, I've not been able to get it, but it seems like there is a list. So food as medicine, if we do that, but that's what really at Mother Bog mostly we're doing, really in reality. And then we are adding certain medicines. And because there is no direct consistency, what you use or other people use, the disparity makes it difficult to give to the world as a standardization and consistency. But, you know, I think food as medicine might, because food is medicine. I mean, that's what Ayurveda is all about. So, but thank you. Keep up the good work.
So I can understand, Sudhir sir, what you want to say, that you want to say that there is a list, but because I guess the US government, they have those norms that black pepper can be called as food over there also, right? If I'm not wrong. So how we can use food products which are listed in the food under food category to gain the desired results, and that is definitely possible, because the majority of spices what are being used, they play a very important role. Even in Ayurveda, every food every food is very well elaborated. What are its characteristics with respect to diseases? So there are the detailed shlokas available which are going to say many things about that particular grain or legume, everything. And we are continuously working on it, because as for Ayurveda, it's not that every oil will do the same job. No, every oil has different identity, and it is going to act in a different way. Even all the legumes, they're not going to do the same work. There are certain legumes which will be going to help you in diabetes. There are certain legumes which may aggravate the. So in the same way, in this way, the Ayurveda sees to the classification of the food products also. But your suggestion is well taken, sir. You are saying that work in the food itself and work on the list which is approved as a food, and come up with the things which can be prescribed to the patients, and the diseases can be reversed with the help of that only. So very well taken, sir. Thank you very much. Now, Krupa, I have one question for you. So have you observed in any patient, you have presented data of 18 patients, have you observed in any patient the rise in the lipid profile levels?
Sir, actually, first I have taken 28 patients total, but I have excluded only included 18 patients who were less in this lipid profile. Sir, a particular, not rise, but sometimes no results we are seeing in some patients, not improving in triglyceride level after diet and after panchkarma and lifestyle modification even.
Okay, because there are certain researches which says that with the weight loss also, when the patient is on, keto diet, or when not particularly keto diet, I'm talking about low carb or low calorie diet, there are the chances that the lipid profile will go up. So whether that you have observed in your practice or not. If not, then it's fine. But ideally, if you can present a complete data, which includes failures as well as success, then it becomes a complete presentation of the facts. So it's not always required to be a crazy for the good numbers, because statistical significance is something that with the average, very marginal improvement in the masses, the statistical p-value becomes significant. So don't work on the averages, work on the improvement, a marginal improvement in every patient. If you're getting in a majority of patients a marginal improvement, then the statistically it becomes very significant. So don't go on averages, because averages are just sum up and you divide it. But the p-value, which comes with the statistical significance of it, which considers how much improvement you have given or what amount of deterioration has happened with the patients who were there in that study. So follow this scientific methods so that you can come up with the real science of topic. And ultimately the agenda of presenting your work is not that you have understood the science, but ultimately it should be exploring a one question and landing into a new question. So that journey has to happen. So your research should end at certain new question. If that is happening, then it is a real research. So best of luck.
Definitely, sir. Thank you.
Thank you so much, sir. Actually, it is insightful. And I think that is what we do at Madhavbag, where Ahara intervention plays the first vital role. And that is why we have made diet box as a treatment here. Considering that patients do not follow our instructions for a very long time, at least for the treatment period, we insist them to follow the diet kit in the name of medication. So I think that is what is giving us some good, tremendous improvement. That is Ahara. Thank you for this wonderful presentation, doctor, and the insight by our chairpersons. Moving ahead, may I now take a permission to call upon Dr. Darshan Joshi to present his PPT.
Hello, I am audible?
Yes, sir, you're audible.
Namaste, sir. Myself, Dr. Darshan Joshi, clinic at Palampur, Madhavbag. Today, I present a case of the accelerated hypertension management with Ayurveda. Sir, during 6 months, I practice in Madhavbag. She is my first case of hypertension. It's unique, and I think it's a second case nearest you, because it's based on the constitution. You say that. Analysis case of hypertension management with the Panchkarma and herbal medicine. Next. In the 1st of January, New Year, the patient came, chief complaint of hyperacidity on headache. Then during the vitals, I was noted that the vitals of BP 169 by 180. So that's why I visit and then apply for ABPM term to confirm the diagnosis and stage of STN. She is not this type of BP medicine already taken, 29-year-old. So she don't think this BP is fluctuation. That's why I prefer the ABPM. And then the 7th January, the start Madhavbag STN complication treatment. Next. The patient is 29 years female, previous related history, renal stone, and no history of any morbidity. That's the first I think that hypertension, based on the weight, but BMI is 23, so weight not here. Dyslipidemia, lipid profile report is normal. Then I investigation the USG, KUB, CT renal, but the kidney function are all normal. That's finally I investigation 2D echo, but 2D echo report also normal. That's no any morbidity to this case of this type of hypertension, but still ABPM stage 2 hypertension with the white coat effect. Next. That's why I diagnosed the stage 2 hypertension caused by the Vata Vritti, because no any complication seen that any kidney function, any heart, no dyslipidemia. That's why I start the treatment. First, I focus on the stress management because Vata Vritti. So primary anti-anxiety relaxing herbal like Brahmi, Chatamansi, anti-inflammatory drug like Sunthi, diuretic like Punonova was prescribed. That's second, I prefer the diet, but patient not take diet of our OBB diet box because very young lady. So very tough task for me without diet, but I will sure with the Panch Karma, which is main and line of treatment of Ayurveda, I will reverse. That's why only on based on Panch Karma and oral medication, I will start the treatment. Low salt, low calorie, low carbs, anti-inflammatory diet as per diet chart only I will given. Then Panch Karma start, Snehan, Svedan, Shirotara and Basti. Then one new one Basti, vasodilator Basti, I was applied. First day, according to STN, start the ABPM and then the oral medication. Then give the 2 times Shirotara, stress some relief and other medicine, headache and other complications are removing because first line of treatment doctor is a chief complaint. So first I remove the chief complaint, then I start the hypertension management. That time I during follow-up I see blood pressure still high. So Vata Prakop was noted. So shift to vasodilator Sneha Basti and follow-up after the 4 month of Panch Karma. It's miracle result only of based on the
Last 1 minute.
Next.
Last 1 minute.
Yes, the patient is completely free from the presenting symptoms of headache and acidity. Day 1, the ABPM report, all BP average is 173 by 126, day BP 177 by 128, and night BP 151 by 120, 112. And after the 4 month, it's 153 by 109. Day BP also reduced and night BP also reduced. The fluctuation rates that 12% systolic blood pressure reduced and 14% diastolic blood pressure reduced. Next, the discussion point of view, the Anuvasan Basti, the vasodilator Basti is significant result. Its ingredient is Salpani, Erandmul, Bruhati, and Pushnapani, and base of the til tel. There four ingredients and til tel. All are research based on the Salpani, the anti-inflammatory, diuretic, cardiotonic, antioxidant. Erandmul is also anti-inflammatory. The root extract of ricinoic combination is the free radical secretory active of stable. The Bruhati also Vat Kapha Hara, Krishnapani also Tridosa Hara. Based on the fourth ingredients and Basti, it's significant result. Next. Also Snehan and Svedan. Snehan with lemon abhyang oil decrease the parasympathetic activity. Svedan Dasmul Kada, amyloid, sodium and water retention. As per Ayurveda, Snehan and Svedan can be used effectively to even bend hardwood to overtime. So we believe Snehan Svedan also be help restore elasticity of rigid blood vessels and thus reducing peripheral resistance. Ayurveda, Panch Karma and herbal medicine can effectively use to management case of accelerated of hypertension. Thank you.
Thank you so much, Dr. Darshan. Requesting our chairpersons to kindly fill in the marks of all the participants today's presenters so that we calculate and we can reveal the results by the end of it. So requesting you all to finish it up and send it across. Meanwhile, may I request our chairperson, Dr. Sudhir Bagga sir, to share his views.
It's a wonderful thing to see stress management, so to speak, Vata related things and using Panch Karma. And the concept is beautiful. We need to start working on management of using. See, Panch Karma is very good, but for the world to accept Panch Karma as a standard treatment becomes a little difficult. And even though it's very effective. So we have to use a milder form of Panch Karma or something in a medicine format, even though I know it's very effective. So that might be a way to look for future reference for the acceptance of Ayurveda in the world, where Panchkarma might become, God forbid, somebody has an intestinal perforation with basti or some other issues. And most of the countries in the world are very litigious, very, legal-minded people. So, but it's wonderful. So keep up the good work. Thank you.
Thank you so much, sir. Requesting once again to share in the marks so that we can calculate it and announce the winners by the end of it.
Sure. I would like to say that treating blood pressure with the use of ambulatory blood pressure machines is really very, very, very rare. Even society is, little bit they are not excited to go for ABPM. But still, if you are pushing hard and assessing their blood pressure during the night with the help of ABPM, this is something very unique, because ultimately this ABPM assessment is going to help those patients to stay away from the heart attack which they are going to come across if they left untreated. And the results what we have shown is really significant, which indicates that the possibility of heart attack or MI can be very well reduced down if the night dipping is normal. And you have done a fantastic job. So best of luck and keep it up. So there are certain questions which you can see in the chat box. Dr. Nishita, if you can ask this question to the presenter, then it will be better.
Sure, sir. Just going through them. Yeah, so there is this question from Dr. Baswati Bhattacharya. What is the mechanism of headache resolving using this protocol? I think this is to Dr. Darshan, and if he can answer this.
Meanwhile, Dr. Darshan is going to answer this question. I'll request Dr. Sudhir sir and Dr. Gurudat sir to please share the marks of all the 13 presenters with Dr. Nishita.
Madam, here in this patient, I saw the hyperacidity is main cause of the headache. So I firstly secure like a medicine, so reduce the pitta in the body and some brain stress relief, Brahmi and Jatamansi for the stress relief. That is good significant result in the headache.
Ma'am, hope you got your answer.
Okay, that's great. So, Dr. Nishita, I think we are already running out of time. It's almost 6:15. And I think we should conclude this session as early as possible, because the next session is going to start exactly at 7 p.m. Okay.
Yes, sir.
Yes.
Waiting for the marks. In a few minutes, I will be totaling it up and letting you know, sir. Meantime, if you want to say something about this session presenters and you want to have your opinion said, please go ahead, sir.
Yes. Yes. First of all, I'm very thankful to Dr. Sudhir Bagga sir and Dr. Gurudutta Amin sir. The way you have guided all the presenters, you guide all the participants today is actually really needful, because the generation, the coming generation requires this guidance. In our day-to-day clinical practice, we always try to give the improvement to the patient. But while giving the improvement to the patient, if we start collecting the evidence, that clinical practice turn into the evidence-based clinical practice, and that evidence-based clinical practice can take Ayurveda to the first-line treatment option. And this is what the basic principle to make Ayurveda globalize. So these Dr. Bagga sir has rightly said that we need to go further and think beyond the just disease. We should categorize the patient in the form of a constitution, and we should think about, like, I really impressed with the way Dr. Neelam has presented today, and the way she has treated her patient. And she kept a patients for a 9 month because she was continuously giving a treatment, same treatment to the same patient consistently for a 9 month, and she got that results because she was believing the principle, she was believing in the concept of Ayurveda, and that belief she transformed into the her patient also, and that end of the day they got a results, and that documented result is in front of all of us. So this kind of a clinical practice is definitely needful, and definitely the next year when we will be coming up again for the third National Ayurveda Cardiology Symposium, all the presenters who were presented today will be the next version of what they have presented today. Definitely, I'm very happy to see there are very new doctors who have recently started their practice, and still they are presenting with a good standard or the quality evidence, the primary evidence, or what I'll call the gold standard evidence, like Dr. Darshan has presented with the ambulatory blood pressure monitoring, and he also has a thought on the hypertension and with the what dosha he want to treat, and he collected that document, and he took all the courage to come here on this platform and share his knowledge and experience in front of almost 200 doctors and all the dignitaries. So this is a kind of, I'll say, it's a courageous generation of Ayurveda is coming, and definitely we need that kind of a courage to take Ayurveda to the first line treatment option. So once again, I really feel proud, and I'm short of my words right now. So I request Dr. Nishita, if she is having the results, I am very excited to listen, because all the 13 presentation were super classical presentations, and I can't hide my excitement right now. Dr. Nishita, over to you.
Yeah. Definitely, sir, there was a neck-to-neck competition, I would say. Just with 0.5 marks ahead,
Okay.
we have Dr. who presented about efficacy of Ayurvedic Sneha Basti in patient with diabetic nephropathy. That is Dr. Prajakta Snodkar. You're leading with 0.54, ma'am, and congratulations on that. So congratulations to other presenters as well. There has been a lot of back-to-back, the same numbers many of you have got, just with a point here and there. There's one person who's leading, and we have to declare them as the best presenter of this session. Thank you so much for all of you for joining in today's session and pouring in your views and inputs. And this has definitely made all the viewers of this session to gain some knowledge and utilize this in their day-to-day practice. Thank you so much. And we will be joining in for the next session that will be starting at sharp 7 o'clock, and hoping to see you all there in the 4th National Ayurveda Cardiology Symposium. See you all there. Bye-bye.
Thank you. Thank you,
Full session
everyone.
coming soon. Thank you. Thank you all of you.